teraz, to jeszcze raz. Dzień dobry. Jest mi
Good
niezmiernie miło,
morning,
że możemy się
everyone.
spotkać dzisiaj
I'm
na takiej
so
pięknej,
honored and pleased to have you all here
ważnej imprezie,
at a
której
very
celem
important,
jest
wonderful event, which
udowodnienie,
is
że pacjent
to
jest
establish and
najważniejszy.
prove that the
Jutro
patient
Światowy
is
Dzień
number one.
Chorego,
Tomorrow
więc
is
z
the
myślą o
World
wszystkich chorych
Day
dzisiaj
of the
spotykamy
Sick.
się
So
po to,
today
żeby
we are here
uhonorować
to honor
tych, którzy
all
starają się zrobić wszystko,
who
żeby
are
życie
ensuring
chorego
at
było
most
jak
that
najlepsze.
the sick people
Dzisiaj
would
stoję przed
have the
wami
best life
nie tylko
ever
jako
possible.
dziennikarka i jako
I'm here
gospodyni,
not
chociaż
only as
bardzo
a
dziękuję za
journalist,
organizację.
however, I'm very pleased to be here. Thank you very much. But I'm also one of you, a patient. And I can say thank you that I am alive. Perhaps not only me. There are more of you here in this room that we witnessed a hardship, very severe diagnosis. I don't like to say diseases. I don't like that word. I would like to think of myself as a healthy person who is encountering different diagnoses, but with the cooperation with many organizations, many experts, different hospitals, I think that I reached a momentum when I can say thank you. And this is here what I want to say to you all, what we all feel as people with diagnosed and with different diseases. The 19th Forum has a very important role in that respect. I welcome all heartily, all of the organizations, all of you who are ensuring the life of the patients, and you can now applaud yourself, all of you here in the room. I would like to welcome the head of all this confusion, who is ensuring that the Forum of the Patients as well as the World Day of the Sick would hold an excellent measure. I welcome Father Arkadiusz Nowa. Now, if we become aware of the fact that we have leaders of over 200 organizations representing patients, this is a measure which has its own dimension. Naturally, we have also those viewers who are online, and due to the internet link, we can give and share with them our energy. We really feel the energy and the warmth, literally, physically as well. Good morning. Thank you very much, Agata, to be with us. I will start with this, you say, because you are here in a double role as a long-term recognized journalist, but you more frequently, we may say, became also a very professional journalist in the context of health issues, as many of you that are here with us in this room who are specialists in different areas, and you are through your own area have an insight diseases of yourself, others, patients, and those who you love. Now, at this moment, I would like to add that Agata is also a founder of an organization known Foundation of Agata Młynarska, Health Without Taboo. And here, if we manage to have a website of the foundation, you're welcome to visit and cooperate with Agata in her scope and capacity as a foundation, as a founder. But naturally, in the future, I presume she will be our regular, not only guest but a participant. Let's not convey this. So we have this affair in media and professionally, lasting from the first great charity orchestra, which we were together holding and running many projects for years in media and outside. Therefore, I must say that I reached a momentum where, looking through the 35 years beyond, it's rather a short scope of time, but from the first great charity orchestra, meetings with the doctors, sick children, and many other projects that I have implemented, and many awards that you were also vesting into my hands. I must say that life has asked me to report because really things were going bad for me. However, there were so many other things that I knew must be done, and like today, me standing on the stage, I am aware that I'm presenting my child that can be part of you. We can share like an umbrella for other foundations and a voice in media. So I strongly welcome you. I'm very touched. It's a debut for me. And thank you very much once again. And very shortly I will start welcoming all of you. Now it's a technical comment for Paweł. Could you slightly ask to dim the lights, because we really have the lights like in a church room. We need to have slightly cooler temperature because it is reaching too high level. So that's the technical aspect. And now, becoming to the World Day of the Sick is a special element, and due to that occasion, we are ensuring that the day before the celebration that will be held tomorrow, we could celebrate here together our event, and I'm very pleased that you are all here and you have accepted the invitations. Over 200 organizations and others are able to observe us online. You are for us the utmost important recipients. We are very pleased that we have the 19th forum, the Jubilee 20 years next year. However, this year we are also commemorating the Institute of Patients' Rights anniversary. So I would like to welcome all of the collaboration with Igor, Marta and Patricia for the years of joint collaboration, and thank you very much. They are very modest, but they really need a round of applause. The essence of our forum is to run a dialogue which cannot be present without the representatives of the cooperatives, that is the parliamentarian or authorities. We see that they are appreciated and ensured by the members of the government and the representatives of the different ministries, and I'm very pleased that this, you and other selected representatives of the Polish Parliament and Senate are part of this event. I would like to welcome, if you will let me, to start with the most close to us, Madam Izabela Leszczyna, Minister of Health. Welcome you. Thank you very much, Izabela, for being with us. There will be certain surprises which I will refer to a bit later. I would like to welcome also Madam for the civil societies, Madam Adrianna Borowska. And again, I would like to refer to our collaboration with Adrianna that I've known for many years. She's been in the Chameleons social assistance organization, one of the non-clerical representatives running our offices, and she's been also known in the Polish and Warsaw area for counteracting homelessness and homeless people issues. Maybe now, like 2 years ago, she's been at the panel with the organizations discussing problems of homelessness with the Minister of Health. And today we welcome you in a completely different role, and now knowing the backgrounds and the roots, you will be able to tackle the problem far better and do more for the groups of the marginalized people. I would like to welcome Senator, Head of the Senate Commission, Beata Libera-Małecka. Madam Beata, Senator, I've been known for many years without counting them, and she's been with us on many occasions. She's been the guest of many events. We thank you for the time and for everything you do for us. We would like to welcome a person who is important, Mr. Bartłomiej Chmielowiec, a very important person to the patients, ombudsman for the patients' rights. I do not need to say more. Everybody knows who is Bartłomiej Chmielowiec, after all. We see that his efforts are being considered and pretty well acknowledged. Also, I would like Professor Urszula Demkow, Undersecretary of State, Ministry of Health, and Professor Filip Nowak, President of the National Health Fund. We also have patronage of the Polish presidency in European Union. I'm sorry, I forgot about that. I apologize, but we are part of the main frame of the celebrations of presidency within the EU, and we are pretty well that we have the patronage of such an institution, and we also have the ambassador of the Kingdom of Denmark. We have this patronage in the working relations with the Kingdom of Norway, Denmark, and we see the certain areas which are giving us excellent examples. We have also two experts of the patronage that we have the Collegium Medicum of the Zielona Góra University, Professor Jolanta Chmielowiec, who is head of the medical faculty at the Zielonogórski Medical University, our honorable main sexuologist, Professor Zbigniew Izbeczny, the chair of the Cathedral for the Womanization Medicine and Sexuology, and Professor Krzysztof Chmielowiec, Deputy Director of the University of Zielona Góra Instytut of Health and Sciences. Now, not only one university is present, we have another partner who is here with us. This is the Medical University of Poznań, that is represented by Ewa Paulina Baum, Dean of the Faculty of Health Sciences, Professor Magdalena Roszak, I don't see, yes, you are there, I can see you now. And we would have also Dr. Rafał Staszewski, Chancellor, but he will come and join us shortly. I would like to refer to one more person. I'm not sure I'm confusing this, but Madam Minister, apologies, Philip, I forgot about you. Yes, Filip Nowak, he is the president of the National Health Fund. Oh my God, have I forgotten you? There was something missing. And Marek Augustyn, vice president of the National Health Fund. When I saw you, I really realized that something went wrong. Now, for us, it is naturally important to have official guest ministers and representatives of the government. This is also a stressful element, because when we invite representatives of different disciplines, different ministers, but Minister of Health would be the one, but holding in mind that there are certain duties and responsibilities that may or may not allow those people to be here with us. Would you be represented by anybody else? But I'm honorably, this year the stress is outside, and I would like to very strongly thank and welcome one person, excellent person, who is running the political office of Madam Minister. This is Damian Węgrzyński, and he is with us, very important person, and he has managed to coordinate everything in such a manner that without you I would really be in a high stress, but with your efforts I really managed to reach the best, and I would like to thank you, Madam Minister, for such an appointment. Thank you very much. I hope I haven't excluded anyone here. And now, with the official statements, I give the floor to Madam Minister Izabela Leszczyna. I give the floor.
Czy tu przy mównicy, czy tak, bo mam kartę.
What is better for me to stand here? Here I have my notes. As you remember, when I was here a year ago, I said then that I was quite nervous at that time because I was new as a Minister of Health. Now I'm also nervous because here there are 200 representatives of patients' organizations and more of you in front of your computers. Thank you very much for inviting me and thank you very much that you are here, that you work. Patients' organizations for Minister of Health is very necessary support. And at the same time, and you know this, patients' organizations are a difficult and demanding partner. Thank you very much for all of your analysis reports for the Minister of Health, which are not always positive. However, they mobilize me, sometimes put me in stress, sometimes make me angry. But this is anger not because of the patients and patients' organization, but anger related to the health system, which does not always work as it should. However, your work is mobilizing, and thank you very much for all you're doing for our health care system. In particular, I will talk in detail about this during the public hearing together with my colleagues and Dr. Koss. But before we get to the public hearing, I would like to say, as the Reverend Nowak said before, healthcare is the fantastic area in which politics is taking part as we know it from the media. Arek Nowak greeted Bartłomiej Chmielowiec, Ombudsman for Patients' Rights. He is the minister appointed by the previous Minister of Health. I saw his work, and I see his work as he's doing it. His fight against all the violations of the rules, and the same is with the National Health Fund. Those who are responsible for the National Health Fund, you know that you are giving not enough money, and you know this. But you see, people are not applauding you that hard, and it shows that not everything must be that political in the strict meaning of this word. In the healthcare, it is not like this, and I thank you very much for supporting me in such a difficult mission. This applause is for you. Ladies and gentlemen, you know, even before I know, you know what is planned to be done. You cooperate with my directors of my departments, and it's very often that all is going on, and everything what is beneficial is due to you, your work, in cooperation with you. I would like just to say thank to Marek Koss and the whole department, and thank to your determination. 135 new indications, new therapies. We introduced them. Out of them, 36 were oncological therapies, 36 with application in rare diseases, and here is the great input of Madam Minister Demkow. and we are expecting 39 new therapies this year, including oncology and non-oncology therapies. This year also we are having ahead, and I'm very glad, apart from the vaccination HPV, which we are introducing together with Minister Novak. A number of schools already applied for the program. This is not their last achievement. The program, this campaign is going to be, it is ongoing. And we are having a great chance ahead of us. We will provide a whole generation of children and youth. Now, those who are starting from 9 years old will be free from oncology, the cervic cancer. Vaccination is the one thing, but also at the same time, we are introducing HPV tests. And they will be part of the guaranteed services, health services. The next, molecular test and genetic tests, genotype tests, to be able to introduce individualized therapy. This is not only a somatic health of ours, physical health, but also psychiatric care, which is also very important for us. We want this year that psychiatric mental health centers are in the program, together with other branches, to introduce new therapies. 9 billion zlotys will be provided for oncological hospitals. The national healthcare plan is providing additional support. We hear that our system is not perfect, that it is in crisis, and it's been years that I hear the same about the social insurance fund. Let us take care about our healthcare system, support it, but it will thrive. The best support we can provide is that we apply the primary prevention for ourselves, to have healthy lifestyles, to minimize our health risks, and then we will benefit from the very healthy life. And to finish with, what do you think? In 2024, a National Health Fund financed, how many doctor visits National Health Fund financed? What do you think? What is the number for the last year? I think it is 87 million visits. It is the number that one person visited doctor twice. And all these visits and all these checks was financed by the National Health Fund. However, we are getting old. We are having diseases. Our society is getting older. And of course, it is natural that we turn to doctors. We go to doctors. But we, as a society, know better. We know how to use the system, and we sign up for doctor's visits. In order to improve this system, we want to make that the patients, it would be easier for first-time patients to sign up for a doctor, to turn to a doctor. Those who are already in therapy, it is easy for them to stay in the system. This is the goal of our intense work currently. It is important to improve the accessibility of the healthcare system for the local community. Please, I need your support. Without your input, our healthcare system will not be successful. Damian Węgrzyński is the head of my political bureau, and he cooperates with the Ombudsman for Patients' Rights, with the Reverend Arkadiusz Nowak, and he's very successful in his work, and he also responsible for contacts with you to receive your proposals and cooperate. Thank you very much. And now, did you want to add something, Arek? No. If not, that I would like to give the floor to Madam Minister for Civil Society, Adriana Porowska. Madam Minister, the floor is yours. Thank you. Madam Minister, my dearest father, Arkadiusz Nowak. This is true. Arkadiusz Nowak was the first person who believed in me. When I started to work, I was 28 years old. It was a canteen for over 200 persons and a healthcare unit for homeless people. And I also started to build a ship. And I became head of the Chameleon mission. Well, I wanted to say just one sentence. More heart in your hands, in your palm. Give your heart to others. It was these were words which I put on the wall in one of the shelters for homeless people. Actually, this is the motto for a civil society activist. Whatever you do, you should be oriented on yourself and on people. Now, myself, in this new role, I am supporting civil society, and we state that the civil society has reached a lot of successes. My role is to support civil society not only topic-wise in the spheres where such need exists, but also civil society and non-governmental organizations need institutional support in helping them cooperate between each other to apply for funds, for grants in the country and abroad, in the European Union, and we are working on it. Ladies and gentlemen, I am a part of the government, and I'm responsible for being in touch with you, with your organizations. I've been raised by the Reverend Arkadiusz Nowak, and what I do is because of him, for him. Thank you very much, Adam. Thank you very much, Madam Minister. We have a St. Valentine's Day in 4 days, and myself and Igor, we decided that we will not hand you flowers, but we selected very handsome and wonderful volunteers to hand you something else. You can say wonderful words to ministers and senators. Adrian, what is written there? That he loves me. Not. It's not me. He loves you. Yeah, and of course there are also food for thought publication, which we edited together with the university in Poznan. This is the fourth item, but not the last, about cultural, spiritual, and psycho-social publication. It's not a trilogy, but the set of 4 publications about patients' care. And now we are getting to the most important part of our meeting. This is the award which is handed over once in 5 years by the initiative of the Instytut for Patients' Rights and Health Education. It is the award for health and the patient. There are several categories: prevention, the second patient, and the award is the selection is by the Ombudsman for Health Right. The committee, the award committee, is the president of the National Health Fund, the Ombudsman for the rights of the patients, and
to ensure that all benefits are on the first place for the patients. First award in the category, I'll see your reaction. It is the prophylaxis. I would like to welcome Madam Izabela Szczyna and Filip Nowak in the category of the prevention. The award is given to Paralympic Committee of Poland. We give the award in the hands of the President, Łukasz Szeliga. Justification. For years, the Polish Paralympic Committee has been trying to reach people with disabilities in various ways, promote improvement through movement, involving them in sports activation workshops and training sessions. For many participants, such activities are an excellent form of rehabilitation, and for some of them, sport becomes the meaning of life and the idea for the future. The year 2024 was a special one for the Polish Paralympic Committee. As many as 23 medals, including 8 gold, were brought home by athletes who took part in the 17th Paralympic Summer Games. These 23 medals are also 23 remarkable stories involving illnesses, injuries, struggle, successfully overcoming one's limitations, dreams, courage, and tremendous determination. Such an attitude inspires genuine admiration and respect. Paralympic sport also has an important social mission, as you're aware. Participation in sport by people with disabilities has a significant impact on their quality of life. It has an integrative and inclusive function. People with disabilities of all ages can take part in sport activations. Once again, a great round of applause to all of them. Thank you. time passed so quickly. Thank you very much on behalf of the Paralympic movement. On behalf of us all, it is an excellent and most important moment for all of those who are tackling the health issues. I have been trying to address this, why sport hasn't been used as a prophylactics in healthcare issues, and with Mr. President Filip Novak, we've been trying to take the measures and widespread the solutions that are applied in the sports that have a good answer to health. They are also conducive for the inclusive society. After Agata's words, thank you very much, doctors, for saving my life, because I would not be here for many years. So after my motorbike accident, I was a sportsman in the discipline. Now, after the unfortunate accident, I ran into a person who was running in the football team with the Paralympic Games, and he showed me a way out. He showed me there are no boundaries. I returned to the skiing and I saw a blind person with a guide skiing. I really became speechless at that moment, and I understood that we should be meeting our dreams and reaching our heights that we are trying to set for ourselves. We should really take the challenges, and I dedicate the award to all of the sportsmen, those who are also helping us in the Paralympic Committee and the Polish Association of Disabled Persons and other clubs for sports for disabled. Thank you very much. The award is to all of you, for all of you. I thank you also very much on my behalf. If we have maths lessons, English, we should also would like to ask Madam Minister and President, please stay for us with us on the stage. Do not go. I just thought we should have special lessons or the sports for those who do not believe. When children would be more involved in sports, they would be really better. We wouldn't have so many problems with the mental health of children if they were more involved in that capacity. Thank you very, very much, and great congratulations. Now, going down to the next category, which are the rights and the safety of the patients. I would like to welcome the Ombudsman for the patient rights, Mr. Bartłomiej Chmielowiec, to award the category award. The award is going to the Oncological Foundation Alivia. This will be vested in the hands of Joanna Frączak-Kazana, Deputy Director of the Foundation, and Mr. Aleksander Pawłowski, a Director Managing. Congratulations to you. The Foundation runs numerous information campaigns to raise public awareness on cancer prevention, early diagnosis, and modern treatment methods. Its activities contribute to reducing the fear associated with the disease and promote a responsible approach to health. Alivia actively works for the improvement of the healthcare system, representing the interests of the oncology patients in their contacts with public institutions and increasing accessibility to modern therapies and shortening waiting time for diagnosis and treatment. For the safety of patients, the Foundation has created platforms and tools such as OncoIndex, which helps patients with their families to obtain information on available therapies, clinical trials, and reimbursement. This gives patients access to the key information that can affect the clinical trials and help in hardship. Congratulations to you all for your efforts. Alivia, rights and safety of the patient. The last category, volunteer and social activity. I would like to invite Arkadiusz to vest the award in the category. The award goes to the Foundation, Transplantation Foundation Liver Strong. The award will be vested in the hands of Mr. Grzegorz Perzyński, the President of the Foundation. We welcome you each and every year. We have an increase of the patients saved with the transplantations. In 2022, there were over 1,402. In 23, 1,805, and in the last year, there were already 2,197 patients. This is giving an impression. The foundation plays an extremely important role in promoting the idea of transplantation, providing support to those people and waiting and their families. Their activities stand out for the exceptional commitment, effectiveness in spreading awareness of transplantation organ donation. The foundation regularly organizes information campaigns, conferences and workshops to break down stereotypes and barriers related to the transplantation. Thanks to their activities, the number of the organ donors and people supporting the idea of transplantation is growing. By sharing stories of people who have wrecked their health and the possibility of full life, thanks to the transplantation, it inspires the involved people. Thank you very much, and great applause. Thank you very much. I would like to welcome you all. It is so beautiful to be alive and to be alive again, second time, with the transplantology and the donor. It is also so good to be alive for others, those that are waiting for their chance, their opportunity. It's a wonderful award for beautiful people, from beautiful people. I would like to thank you very much for all of this, and the award I would like to dedicate to my mother, Bogusia, who's taken the effort over 22 years before to the translation of liver, and my donor without whom I wouldn't be here, someone who has not known me and ever will. So a great appeal to you all to talk and discuss the problem with your families. What is your decision, whether you are able after your death to save at most even 8 people I live due to such a decision taken somewhere? I am totally touched. Thank you. Please bear with us, do not go anywhere. Yes, we have also external director of the events. Yes, ladies and gentlemen, I just want to say that we are honored with the award, and we are addressing this to all of our staff who are every day over 15 years been ensuring support to our patients in oncology. From our perspective, this award is a certain proof of trust that as an organization we will be staying with the oncological patients. Thank you very much. Thank you. I would like to say, and add for myself, can you bear just a few seconds with us? I know, I am aware. If you could come slightly closer, you will have the family picture taken. So let's members, we still have more awards. We have a surprise. Madam Minister she promised, and she keeps her promises. We would like to invite you, Madam Minister, to take the floor again. As you remember, thank you very much. I said, how come Minister of Health is not granting any awards, having so many excellent patient organizations here? And I have really run myself into trouble. It is so hard to select one. You are so good, all of you. You are the best. You are exceptional. And you all deserve the award very, very much. But we have here with us, like many other organizations that are doing so much to support patients. Therefore, I took a decision that 2 patients panels, one with the Ombudsman and one with the Minister of Health, will be granted with the words of appreciation for creating the panels that are collaborating with the ministries and the Ombudsman Office, as well as our Minister of Health in our day-to-day work. But I also have one more surprise, which is giving from the budget of the Minister of Health 10 million zloty for a competition for NGOs, patient organizations that would proposed prevention and promotion of oncological prevention. Why? Well, oncology is the second killer. Cancer is taking its death toll. So this competition in the first quarter of this year, end of this quarter, you would be able to support us with the concepts how to promote the prophylactics in that area, because we still have difficulties to counteract, and the patients' organizations could be a support for your actions. A special award to the patients' organizations group is Father Arkadiusz Nowak. Is he admitting to taking the patients panel at the Ministry of Health, and Stanisław Maćkowiak, the head of the Ombudsman panel for the patients' rights. So we give the award in such excellent hands. Wonderful meeting, very touching moments. Ladies and gentlemen, this is an award which you all would be part of the picture. It is not yours, it's not mine, it's not Stanisław's award. The panel, the council that is with the Minister of Health, we have many such organizations that are part of this body. And thank you very much for this devilish, angelic devilish concept, but this is a way to award and distinguish all organizations. So this is for all of us. Thank you very much. Now we would like to invite you to a family photo, and now I have to ensure we have you all of you that are in the first row. Come closer. So we see the banner. Be sure that you are part of one group. We are one big family after all. I'm very pleased. It is very touching moment. An award on the World Day of the Sick. I don't think such a picture was taken before here. Now, thank you very much. We wish you all wonderful, fruitful debates, and first of all, health, patience, and effectiveness in your operations, because this is utmost important. Now, if you will have any concepts how to strengthen our team, I think I owe you something for what I have been given, and well, see you on the road. Goodbye. Now this very official part is already beyond this, and over the time as we are disciplined, and we still have like 5 minutes overtime, and now we will be holding a debate, which is the most important element for you. It is the social debate, which is with a long tradition, and representative organizations are reporting before the World Day of the Sick questions, issues that they want to be taken and given over to the management of the Ministry of Health, and the ministers and the management have opportunity to get themselves ready, to prepare, give answers, and in this social debate To respect our time, we, as for many years before, without going through the questions, ministers are already acquainted with them. We just say organization and what question was put on the floor, and then we have a bit of shortened, abbreviated version, and the minister is giving a feedback, and this is what we start with the decision of Madam Minister. In this social debate, we will have Professor Shula Demkov. I would like to welcome you, Minister Marek Kos, Mr. Nowak, President, and we have Marek Augustyn. Yes, those questions are rather hard, so I don't blame him to having a replacement. And now we have with us this moderated by Krzysztof Jakubiak together with me. So please take the floor, come to the panel, and we are starting.
Dobrze, proszę Państwa, nie ma pytań trudnych. One, znaczy są trudne.
Ladies and gentlemen, there are no difficult questions. We know that sometimes it is better to receive a reply which would not be that satisfying as we wish, but it is better than to have it than not to have it. And we understand that not all of the questions you asked, we will be able to receive a reply satisfying for patients' organizations. Ministers and presidents of the health fund, you know, it's better that you tell that these expectations cannot be met than just to avoid answering. We hope that your answers will be concrete on the topic. The first question will be for the representatives of the Ministry of Health. Anna Kupiecka, Onco Cafe, is here with us. She asked this question. Last year, Madam Minister Izabela Leszczyna said about introduction of the breast tests for labor checkup. The question is, what is the status of these works? What are other ideas of referring women for checkups? Thank you very much for this question. First of all, I would like to say hello to all of you here, to greet patients' organizations. Over a year ago, I met patients in different circumstances at the office. And now I have a chance, and we all together have a chance to help a wider group of patients at the same time. This is a great joy, but also a great challenge, because not all of the problems can be solved easily and quickly. Going back to answering to your questions, first of all, the mammography. For all of the women starting from 50 to 70 years are available free of cost, and it is accessible. This is my age range too, and I use this program. Every 2 years I use the mammography test. I make this test. In my clinic in Ursynów there are no queues, there is no crowd, the waiting time is very short, and they call me and invite me to the check. So these tests are easily accessible. Madam Minister Leshina and the Ministry of Health, we are determined to develop prevention programs, all of them, not only mammography. In general, Ministry is working on preparing a prevention program named like this, My Health. This is going to be a new prevention offer. We work with determination on it. It is going to be the next step after the program 40 plus, and will include a wider range of tests. The works are underway, and I'm not now able to say what is going to be the final version of this program. The doctors of the labor medicine are going to be involved in this program, prevention program, and this aspect is also being discussed and will be included in the new program, My Health. Thank you very much. The next question. Do you in our public hearing, there will be a number of questions concerning medicines. The foundation Together in Sickness, Marek Borkowski asked a question. The question is the prostate cancer. In January this year, the large number of patients with this cancer cannot see the progress of the disease because due to lack and insufficient molecular metastasis checks. Will there be a possibility for treatment for those who do not have the mutation? Good morning, ladies and gentlemen. Thank you very much for inviting me to take part in this wonderful forum. This is a good question. It concerns oncology diseases. The status cancer is the fourth around the world. It is very serious disease and widespread. However, in terms of death rates, that's not the leader. Because there are good targeted treatment methods. These two types of sickness, there are treatment methods available for the sick. In January 2025, the new therapy was introduced. It is available for the patients with mutation of the gene BRCA1, A2. In terms of other therapies, are in the process of the recommendation decision. There is an application for to be refunded by an institution. Certified, but it is also for mutation BRCA1, A2, APM, AB2, and 51C. As I said, the application was submitted. However, it is in the process of assessment. I will have time to tell more about Refund Act and other conditions to take a decision by the Minister of Health. There are almost 14 processes underway currently. And I also would like to add that we have an application for one more therapy. It's all up on together with other therapy without meat. For mutation BRC1, A1, A2. It is on the stage of assessment, formal assessment. It is being conducted by the State Agency for Assessment, and it is being assessed from different sides. Also, it is an object of work of the transparency panel of the Ministry of Health. It is being assessed by the Commission of Economics, and the results of the panels will be presented to the Minister of Health. So these decisions will come soon, and the recommendations are extended. The genetic tests are available. It is possible to make the genetic test. Many patients can do this. This mutation is the case of many patients. Also, I would like to add to what Minister Kos said. Genetic diagnostics, as the genetic diagnostics is concerned, we are also considering this diagnostic from the blood tests in outpatient settings. It is going to be easier to introduce such therapies. Apart from the status cancer, it is going to be different types of cancer too, including breast cancer. It is going to be possible to make such diagnosis in outpatient settings. Thank you, Madam Minister. Next question. Part of this question concerns concrete treatment. Association Dynitash Talentium. This is the MS due to this condition. Patients are losing the ability to move, or the muscle reaction. The first therapy was registered last year. What are the chances that this therapy will be applied, will be available in Poland too? The process is described in detail in the act of the for therapy refund. It is there are criteria which have to be taken into account. First of all, the application should be submitted by a responsible institution. It is either a producer of the therapy or a medical center. It is actually, such an application was submitted last week. It is a very preliminary work which is being done to achieve the status for refund. We need several weeks and months to go. There is a range of criteria that should be assessed, as I mentioned. We have a group of about 100 sick waiting for this therapy. This condition requires genetic diagnosis. This process takes about 9 to 2 years. What does the Ministry of Health intend to do to shorten the expectation time for genetic diagnosis? The patients with SM are in a special situation because it's very quickly that they are losing the ability to move and to breathe, and there is a huge need for therapy. And unfortunately, today this therapy can be available for patients with mutation. This is not the majority of the patients, MS patients with the multiple sclerosis, but at least some of the patients can get the chance to slow down the disease. The process is very necessary, at least due to two reasons. First, we need reliable laboratories which are going to be under strict control and will give reliable test results. In Poland, there are no legal acts which would protect our genetic materials. And our genetic material identifies a person even better than a name or a last name, because it cannot be changed. However, our DNA is not protected. The samples are going to other countries, including to China, and we are afraid that after some time, our DNA can be an object of attack from the side of some not very friendly institutions and bodies. We are working on the special act. We have come up with 2 drafts. One of them is from 2012. It was prepared, however, not adopted yet. However, during this period of time, since 2012, a lot has changed in the world, in the legal situation. So we can say that 2012 it was the last age in terms of genetics. And so that is why we have started these works all over, and we will do our best to proceed and to come up with a new draft law. Tomorrow we are going to have the new discussion with the Minister on the genetics, and we invite you to take part in it.
And next question is from the Foundation Sextet, Agata Polak-Rygiel, and this one is relating to the vaccinations in HPV as the prevention activities. The question is there any hope to outstretch the age cohort for the HPV vaccinations? So now we are inviting and encouraging kids aged 9 to 14. However, the clinical tests indicated that the HPV becomes effective at a later stage with the women and men age groups who are already active sexually, and there is no any contraindication to have those vaccinations offered later on at later age. So I encourage strongly. The epidemiological data indicate that For many years, the vaccinations have been given for the society, and the society in Australia or those countries in New Zealand have completely managed to eradicate the or Scandinavia, the HPV. So after those several years, we see the dropping rates in the HPV group. Now, in Poland, we have the highest rate of the people who become infected with the HPV. I don't know how far more I should be encouraging. I have witnessed many problems and looking at the statistics when we see the vaccination of a broad range of the population being implemented. We observe the cervix cancer being diminished for men, the cancer of penis, or rather more often we have also oral, so penile cancer and oral organs. We have viruses that could be also given to the partners through the sexual path. Would that be all? Next question is by Agnieszka Wałczenko. This is a patient's organization for the heart diseases. The question is Ministry of Health working on the ways to have vaccinations ordered for the co-inhibiting diseases? Is there a way to introduce such a system that would encourage for such vaccinations? One of the representatives of the ministry maybe would address this issue. In general, we run works on introducing such solutions where the pharmacist could be verifying the right for the refundation for the vaccinations, but it's not being run by the ministry. However, there are certain plans that we would be giving more time. Sometimes doctors are also without the full knowledge and they cannot understand, and if they are making mistakes, they are paying for them from their own pocket. So we need to ensure better education. Maybe Marek knows more here about that. Well, I can go back to the act on the financed services from the public funds from the last year. The act has been giving broad authority to the pharmacists where they can also produce recipes and they can also prescriptions where you can go to a pharmacy and obtain a prescription at the same time be given a vaccination. This is something big. However, last year, very intensely, there was a special department that had a team working on the prescriptions and the e-refunding. If we go into that type of solution and having doctors, we can also ensure prescriptions for the pharmacists. I think this is in front of us. This is an excellent concept and very good recommendation on behalf of the person giving that question. Thank you very much, Minister. Now a question is addressed to Bartek, Minister Chmielowiec. We had Minister Leszczyna referring to about 80 million visits with specialists, which is really perhaps unbelievable, but this has been confirmed nonetheless, and this is really showing the queuing systems. Naturally, they could be shortened. but considering also the discipline of the people who are sometimes not reporting to the visits, and this is one of the major problems. It is not only patients' fault, sometimes it's logistically impossible because sometimes they cannot simply break through the phone lines to cancel their visits. Now, queuings and queues are one of the major problems they witness. Perhaps you have a solution how to improve the system, to shorten the queues. This is a very large question. However, the Ombudsman office is to help patients, therefore we give the question to the Ombudsman. Good afternoon, ladies and gentlemen. I would like to welcome you all and thank you for the invitation. Yes, and the question. This is a very big question, very hard to address it, maybe in proportion to the previous speakers. First of all, perhaps Madam Minister Izabela Leszczyna has rightfully justified and tackled the problems and giving the concept of solution how we could change the system to narrow down the focus on the coordinated assistance to the main two killers, the oncological and cardiological networks. A coordinated work in medical services and deburden the specialists, not necessarily be part of that. Also to have an aggressive system of assessing the pricing for the first time visits, and also the issue of the change in the hospitalization. This is important. I would like to ask you not to go down into false paths. When we hear from the politicians saying that they are going to close down hospitals. No. This isn't the manner of work. We want to adjust the hospital networks to the needs of the patients that, on one hand, should respond to the challenges and increase the safety. I want to give an example. Those examples are given to the gynecological and obstetric wards, but the health of the women, where we hear 80 births per annum, 1 per 3 days. But let's give another example where we have a surgery, general surgery performed, and radical prostatectomy. We have with us also one of the robotics work on that. In 2023, about 20% of the surgery wards have admitted less than 1,000 patients. Out of those 1,000 patients, only 500 were admitted in the surgery process. That means that about average, 1 patient was operated per day. Now, considering this, would you like to go to such a ward? Because this was your necessity, would you like to be operated for the prostatectomy in radical manner? For 140 entities are offering such surgery. About 23 of them have run less than 10 per annum. And that is naturally economical issue. We have to maintain the ward. We have to pay all specialists. We have to be sure that others are in competition. Therefore, we have this dramatic increase of the rates and shortages. However, there is also a safety issue that we have the necessity to introduce a reform where those wards would be adjusting to the needs of the patients at the local level. I want this to be clear, and we have to understand to run and introduce the reform. Now, in the respect of the issue of the measures. We as patients should always be sure that if we are able to cancel the visit, we should do it. This is a way to perform the Ministry of Health, and the central registration is undergoing. It works naturally. There's also responsibility of the management of the medical centers. Some of them are taking it responsibly and managing every cancel visit is giving losses. So the system is being run and built in such a way so we have a realistic way of canceling visits. We observe visit improving at the local level of the basic healthcare issues, and we see those that do nothing. So when we see you can't go into the system, you cannot call the center. When you see that you are being ignored, I strongly recommend give this to the ombudsman and report it. I would like to encourage you. We are doing our best to change the world to better together with the Minister of Health. We, in the pandemic era, where you could not break through the line and reach the medical center, and the situation today is so much different because together with the National Health Fund we enforced changes. We asked for additional people in the switchboard, operator areas, registration, IT services, and so on. All of this is changing. There are centers that have to do a lot, but slowly, gradually, we are doing improvements. Together with media, we are promoting those that are responding to the challenges of the patients. So if you do have such examples, please give them. Those good practices will be promoted. Thank you very much. 2 more comments. After tomorrow at the forum with the organization of patients with the minister, we will hold the results of the poll where we were discussing the e-registration system. We will see the results of the pilot program, and then the act that you related to on the reform of the hospitals, which will be given more by Mr. Szafranowicz. He is responsible for this area. He is also responsible for implementation of the act. And we still held another question that perhaps you may give us an answer to, Marek. It was addressed to you as a National Health Fund. One of the questions was about the situation where there is a need to transform a hospital from a long-term or palliative care to other healthcare services. Who would be the person taking the decision on not liquidating, but perhaps translating or transforming this hospital? There were already voices on who would be responsible. Should it this be National Health Fund being the responsible agent? Maybe you could address this problem. And then the second question is on the palliative care given by Madame Rugnicka from Ecological Association, who would like to see an answer to the cancelling of limits on palliative care, and some more feedback from the panel working on the palliative issues at the ministry. Yes, there will be more about that in a moment. Hello, I would like to welcome you all. Good afternoon. I'm very pleased that I can be here with you to discuss those rather important issues, and well, the responsibility for taking decisions to me is the responsibility for all who are part of the process. No. This has to be a certain consensus, and perception of the needs at a certain area, with the conditioning, geographical, local, and many others, and economical, naturally. It would be difficult for the mayor or a starost of a certain community who is an entity working for the local community hospitals, when that person should have a sober assessment of all the needs and demands at the local level. As a national health fund, we should be giving and offering support. Naturally, the act that we refer to is still undergoing certain consultations, as Madam Minister referred, reaching its third round. It is giving freedom where you can reach decisions, and it is hard to adapt and take decision for one institution who is ensuring the NHS services. It cannot be just Ministry of Health or any other organizations that are functioning with the system. Now, this is my opinion. It should be a consensus, a result of all support of all of those partners, and awareness where there is a necessity to run changes that are required and even in the guidelines of the act that is undergoing drafting process. So the founding is responsible, yes, the founder organization, naturally, but it does not mean that an organization that I represent, such an institution, shouldn't be more actively participating as an institution, offering support, and as a result being a beneficiary of those actions. Okay, we have an ad. Maybe a little bit more to adapt with the act on the medical operations. The entity of the particular hospital at a communal level and the certain commune or the certain region, voivodeship, military hospitals or police hospitals, depending on the ministry. The final decision is in fact depending and relying on their voice. Naturally, it should be broadly discussed with the voivode, with the voivodeship plan for transformation, for the opinion and consultants at the local level. That should be a decision reached by consensus and elaborated to the benefit of the society. But this is an entity finally that is creating this. Now, going back to the second part of the question, just to call, yes, we managed to hold a lot of works. We managed to narrow down the limit on palliative care and hospice. We allowed for a better release of the service providers who are offering services in that sector. As you remember, 1st of April last year, each and every hospice is guaranteed for every service that has been implemented over the contract, above the contract price. Last year we introduced a new and amended tariff, which is offering a big change that is providing the outstretch of the palliative services, and this tariff is operating from July 2024, and it is effectively giving better offer and quality of the services given to the palliative care clinics. It It is worth to mention that we have a product of qualifying counseling, which is allowing the day the patient becomes under the palliative care of additional service. I am not sure if I can relate to the very specific indications that, for example, talk about the transfusion, blood transfusion in the palliative care. Here, we can underline that we are collaborating with expert groups in palliative care for ensuring better implementation of the blood transfusion care solutions. This also was introduced and assessed by the State Agency for Assessment of such services. The data from 2021 indicate that blood transfusions were offered to 1.68%, which is only giving 500 from 30 few thousand patients that were given such blood transfusion. The death rate up to 30 days from the blood transfusion reached 57% and 23% the day of dismiss. And the final figures are also reflecting the fact what type of procedure was introduced in the guaranteed services, and I think for all of you who know how this mechanism is operating, we are at the very end of this path and we are financing, but before this it has to be in the basket of guaranteed services. So all of this work has to be done at the stage of the consultation prior to us who will have a special decision and given the service within the basket and a decision to fulfill our work.
Also, the very important issue of the issue of the extraintestinal nutrition. That was also supposed to be included in the services, but not everyone realize what is the role of the National Health Fund in this process. We literally right away implement what is written in this document and also in this issue. Now, as we see that the minister is dynamically taking the decision on refund. Now the next question, Elżbieta Markowska, she is the representative of the Organization for Oncological Patients. The question is, when the Ministry of Health undertakes the measures to provide the patients with hormone dependent breast cancer, when the treatment will be provided. Thank you very much for this question. In the beginning, I would like to mention that the medicine program is the model program in the European scale in terms of patients with breast cancer. And all the types of the breast cancer, the treatment is provided. I do not have the data of 2024. However, based on the data on 2023, 118 treatment program. Some programs have been very expensive in that year. Breast cancer treatment, 1 billion zlotys was spent. I know what is budget of the National Health Fund and what all the limitations are. This funds at the disposal of the National Health Fund. We can spend 18% for medicines, all medicines, not only for including medicines in the pharmacies, hospital medicines. The application concerns the refund of the medicine, very modern one. It is used for breast cancer with metastasis, with the low R2. At this very moment, I would like to say that it is in the process of the decision for refund. This decision will be taken within the coming weeks. So the application has been submitted. That you are currently assessing, right? The Economic Commission and the decision. The next question, Ilona Roszkowska-Zamieniecka, Association 1 in a Million. The question is, this is about hemoglobinuria condition. About 20% of such patients have a problem with their veins. Therapy for this group of the sick becomes very troublesome, and the question is whether there will be a possibility for the sick to use the subcutaneous treatment outside of the hospitals. These therapies have been registered already, and the question is whether the Ministry of Health considers the such treatment for the Polish patients. My answer will be a partial, because it concerns the assessment of in January 2025, the latest refund decision has been published. In case of hemoglobinuria, there are medicines, eculizumab, rabulizumab. These medicines are being used in the program, and there is an access to them. There are different methods and accessibility. What is important is there are a number of applications have been submitted for refund. These are denicopan, iptacopan, both are for oral use. The next medicine, Crovaliba, Piaski. This is one doses intravenously, and later it is used subcutaneously. However, a formal assessment is underway, and we are planning the further steps of work on this medicine. As we mentioned before, there must be an application of the responsible entity. Next question, Monika Kaszmarek, Foundation of Association for Diabetes Patients. Over 3 million people in Poland have diabetes. So normally we say people with diabetes, not sick with diabetes. What the Ministry of Health is planning in terms of diabetes, monitoring, treatment technology, what the patients can expect this year. Next question for me. So that is why we just grouped these questions. Our task is quite hard in this respect, but we are trying to cope. Starting from the 1st of January 2025, the medicine Rulicity returned. It is again part of the list for refunded medicines. Additionally, there are 2 more applications for 2 more medicines. However, it concerns the application more widely than intended. The responsible entities proposed administration based on diminishing of the doses applied in a patient. What will it look like eventually on the list of the medicine to be refunded is ahead of us. Michał Witkowski, chair of the foundation of the leukemia, people with leukemia. We are working on this issue, on the improving of treatment in terms of this sickness. We have applied a number of solutions, introducing medicine. We plan to have it in October. So this is about thrombosis. So it is ahead of us around October 2025. The majority of questions you asked concern works underway. So that is why patients are asking. They are monitoring very closely. In the Ministry of Health, all the processes are transparent. The economic committee meeting will take place next week, and the report will be published on the website of the Ministry of Health. In terms of the Economic Commission, we discussed it in a Cabinet of Ministers. One of the demands of the patients' organizations was that a representative of the organization would take part in this meeting of the committee. So we do not have even the single opinion, and I know that the minister referred to it, said that it was like that such form of a participation of the patients' organization is being considered. Indeed, it is very important. January the 20th, the Ministry of Health submitted an application. They request to change the refund Act. We have started the internal process. The next step will be the interinstitutional consultations. In this change, the patient organizations are supposed to have part in the process. Maybe not in voting, however, the possibility to present the vision also to the economic committee from the point of view of patients. We believe that this act will be proceeded promptly. Thank you very much. For many representatives of our community is a very important issue. Now the question of mental health. Association Hope. The question is regarding financing for mental health centers. In the media, there was a discussion in possible difficulties and shortages, financial shortages. And Ms. Agnieszka is asking about open dialogue approach as a therapy applied in mental health centers. So this is the question both to the Ministry and to the National Health Fund. Madam Professor, I will start from the organizational side, and there is a pilot project underway from 2017. It showed that the mental health centers and the financing rate is a very good method to finance and organize the work of such therapies. In this way, mental health centers which work without medical doctors will be able to function without involving full-scale medicine. Nevertheless, after having analyzed the results, the effectiveness of different mental health centers is different. The discussions have taken place. The goal is not to change the method of financing and introduce the payments for visits on consultation, but to provide a different scheme for financing for less effective forms of work. However, to go into wider scale for wider population. I think that for one inhabitant, the rate for one inhabitant, it was 151.4 consultation per year. We are conducting dialogue with the mental health specialists concerning the assessment of this pilot project. The panel consists of the psychiatrists, mental health specialists, representatives of the patients' organizations, and all of these specialists will have their contribution to the discussion, and I hope that there will be final recommendations based on this pilot project will be presented soon. As far as the financing is concerned, the floor is yours. Method dialogue approach is not included in the guaranteed services
and being funded from the public funds. prior to be part of such services, it is completely beyond our reach. It does not mean we should not be actively participating in drafting update of the law in the area, and it is worth mentioning what Madam Professor, Madam Minister referred to, adopting a panel group that I think it was 4th of December established in 2024, and within the works of the group we have certain areas. Minister, if you allow me, I will tell what the ministry is decided in that area. 4 different base points: analysis of the needs in the healthcare of mental care services. Second, preparing solutions in the protection of mental health with the manner of organizing special centers upon the pilot program from the decision of Ministerial 2018. In item 3, we have a strategy to be prepared and a final report in item 4 with the conclusions and submitted to the Minister, to the Minister of Health for review. I decided here to look down and to see the philosophy of the method known as ODA, and it is already with 30 years of a history, where in the cooler countries in the north, Finland and so on, they started to implement for many years. In Poland, we also are very pleased to be proud. United States, Israel, this open dialogue approach has a pretty good result, and this can be given for a very good proposal as a method to be part of a mainstream therapeutic circulation. So, from our point of view, we are just waiting for this service to be part of the basket of guaranteed services. Minister Urszula Demkow will give answer to the question for the diseases of brain, to have an assessment of the strategic document for the years 21-27 with the perspective to year 32. In the opinion of Jagoda, there is no mention as to the neurology and changes to the treatment. Neurology is not coming as a word on over 300 pages. So neurology and brain maybe 4 times. So the question is given whether there are any systemic changes planned if they have not been given in the strategy of the country for the coming years. This is a criticism. Well, I have not been part of the document, and I think my colleagues and ministers have no responsibility. We not defend ourselves. I think the authors are right of the question. Most is important. Without brains, we wouldn't be able to do anything. So we are also giving our own signature under the question and problems. I think we are working in the area of neurology. Maybe there could be done more, and there are certain doubtful things that can be done. And a lot more could be introduced, but I am in rare diseases area that relate to brain, that they start in 60% with small children that are literally a day out of birth. They are not developing properly. They have different issues in neurological sphere. So to hold a fast diagnosis, I have a colleague sitting on the left, to the left of me. We together are trying to use the therapies that are radically changing the prognosis for the kid, for the infant. But sometimes the brain is still in our focal point. So I think quite often disease which is part of a stroke, and I think that we have another service. Yes, stroke is in this therapeutic window tackled. It is giving the right measures and faster interaction. Within the area of our interest is also innovatory methods of stimulation, deep stimulation of the brain tissues and structures. Certain neurodegenerative, like Parkinson's disease, for example, and other dementia illnesses. They are part of our life if we live long enough. So we have to remember that that certain diseases we have to counteract. To increase the neurology role, we should be introducing questions to the medical exam for a doctor. Those that graduate of the medical university should not treat neurology as a subject to be learned quickly and forgotten about. The neurology should be part of the work and life of a physician. No matter what path they choose, they should have they should hold the right knowledge in that area to be able to diagnose, for example, a stroke. Just maybe two more words. As a Ministry of Health, we are strongly interested in neurology and neurological disorders and treatment of those. Even if we, just to underline, we will hold an international conference in this year about the brain health that will focus on neurological scientists from Europe and, of course, from Poland. We will be part of this forum. As Madam Nemkov, Minister, referred to, these are dementia and many other diseases, neurodegenerative, originating from brain disorders and strokes, from the thrombolysis and other measures that can support. Because I've never been witnesses, but from the doctors who come with a stroke, with blood deficiency, they are treated at the operation block and they have the clot removed, and after or prior in complete unconsciousness wants to leave the operation table because they are so well treated. So we really would try to ensure the least number of them, but to have them so effectively treated as the ones that we hear of. Now it's only 4.5% with the strokes are offered such measures, but from the European level we hear of 20% and more. So I want to add that there are other panels tomorrow addressing the diseases of brain. So Three quick shotters. Inga Szrawicka, President Europe, Poland. What to do to be sure to refund colon cancer? The drug is known through Intyvit, no matter what is the name of the drug and treatment, but what to do to make sure the therapies would be within the refunded medications. I understand it's been also already assessed by the European Agency for Drugs and Medications. Well, what should we do? We have no impact on those responsible agencies. If it's submitted, it's in the process, but the patients do have an impact. They can contact and demand to have those drugs, medications being approved. But we do have a good information for the patients. In the new refund law, there is going to be a new decree where we will have an opportunity to demand from the agency. We can have an initiative, not naturally expecting a positive answer, but we do have a chance that we can prove that we really are ensuring that some frogvintining, this is a drug that has been submitted by the company named Takeda, and it's called Rezuka. It's new application made for request. We have this application sent to the agency. It is undergoing review. It will be months, but it is already in the process. It's in the pipeline. A question from Anna Moskel for Association of People with the Aubrey disease. Not a specific, but transferring the program and Fabry disease closer to the patient.
To give them the possibility to collect the medicine locally and the possibility to administer the medicine at home, so they do not have to turn to the hospitals. This is a very good question. This is about the program. I understand. This is about the possibility of a patient to access locally to this treatment. The hospital treatment is troublesome and takes time, so it is better to provide these medicines at home and the treatment at home. I will turn here to the amended refund law. The list of the medicines to be refunded apart from chemotherapy and pharmacies, drugs. There will be also a method to provide treatment in outpatient settings. So something in between home treatment and hospital treatment. If the responsible entity takes a decision to provide the treatment, it is a difficult issue because responsible entities very rarely agree to such treatment, but in some programs it functions. A much better solution will be a new access category. This is what patients are expecting. Lilia Nowicka, the chair of the foundation with Friedrich disease. This is disease, a rare disease. Before February 2024, there was no treatment whatsoever. However, the first treatment was registered, omaveloxolone. And now the question is whether the ministry received the application already. And the question is whether the ministry notices this small group of patients and what is going on with the treatment for them. The group is very important, although not very numerous. These questions are about medicines concerning which the applications have been submitted already. The medicine Solon, this is a very interesting case. Skylaris is the trade name. The application has been submitted. The preliminary assessment has been made. And it's been referred to the Agency of Medical Technologies and Verification. However, at the moment, we have no results of this assessment. However, it is in the pipeline. According to the refund law, there are 14 criteria according to which the assessment should be made. And so it will take several weeks, not months, to complete this procedure. The medicine is available in the framework of our procedure. It is important to inform patients about this. Last year, this program was financed for 14 patients in different age, from 15 to 64 years old. 8 entities, organizations have been included in the program based on their applications. We have 4 last questions we'll have time to ask. Is there Ola Lewandowska here in this room, the national consultant? She was a minute ago, but now she's not. Can anyone say that she's requested to contact urgently with Madam Director Sanojca? And now the question. The question from Barbara Pepka, Foundation The Stars of Hope. And a question to Madam Minister Demkov concerning the hepatitis C. In the previous year, we've had a breakthrough in hepatitis C treatment. However, there's still a problem with regards to the systemic diagnosis and the hospital care, and are there chances that the diagnostics is wider? The diagnostics is available for all in the framework of the home basic health care, primary health care. If the hospitals are concerned, such diagnostics is offered to some groups of patients, including pregnant women. So this is the question of consciousness of patients and the doctors. So you should request for such diagnostics. Polish Association Stemia Gravis. What is the plan for rare disease treatment in 24-25? This program is not being implemented. This is not true. The plan is being implemented, and some of the parts of the plan have been implemented. We still have 8 minutes to go. So I can discuss a number of tasks, but in order to discuss this, I would need 20 minutes more. That is why I'm not going to do it now, but I invite you on the 28th of February to Łazienki, to the meeting with the representative of the Association of the Rare Diseases Orphan. We will discuss the process of implementation of this plan. So now we are in the process of implementation. And the implementation is rather advanced. And now the question to Marek. The first question. The question is about imposters, how they feel in this field, how to improve the competences of the Ombudsman of patients' rights to fight with the phenomena of imposters. And the second question is the compensation funds for vaccination in cases of emergency for medical staff. How this fund is being used by patients? What is the method, alternative methods introduced and proven effective? As far as imposters are concerned, as you hear in the media, in my opinion, is just the tip of the iceberg. Mr. Oscar D. earned over 4 million zlotys. Some of you may have heard of this. A lot of people were tricked by him. Please pay attention to different kinds of magic specialists. This is not only the minister cause, but the whole world. Those people who say that who say they know how to treat cancer would receive the Nobel Prize. This is not always true. This is not true. So that is very important to fight against such phenomenon. In the ministry, we work with the draft law, which would make possible to eradicate such phenomenon in Poland. This draft law is going to be preceded by the parliament very soon. The compensation fund also is working. 12 million zlotys have been paid to all medical specialists as a result of medical mistake. And I think that this fund implements its role very well. From the very beginning, we thought that we would observe and assess, monitor how these funds work and what can be improved so the services are more available and more beneficial. So this is the question, to merge all these funds and make it easier to manage and improve the availability and accessibility of such service, so the patients do not have to turn to the courts and to have the opportunity to receive the decision within weeks. Maybe it is not discussed very widely in public when we take a decision. Yes, the medical error has been taken place. Why it happened, and the institution has the obligation to introduce solutions to eliminate such possibility in the future. We do not live in the ideal world, however. But there is a chance that an institution improves some procedures and solutions, and in the future patients will not find out themselves in such situation. I know that out of this 3 funds, this fund of the medical errors is the most popular, so to say. And now the question is to Marek Augustyn. In the media, it was widely discussed the question of the bad situation of the National Health Fund, which naturally cause a question how safety of patients will look like and treatment availability will look like. So this is a question to you, Marek.
Oczywiście sytuacja wygląda, bo oczywiście w każdym artykule na pewno jest wiele rzetelności dziennikarskiej.
So we would like to hear your opinion. Sometimes there are some misconceptions, sometimes there is, maybe, as it was rightfully given in information from media, that the system is very bad shape. I don't like this bad shape tag. It really is giving a context, giving a worrying opinion. The NFZ, National Health Fund, is offering all of the contracts that are entered are without limit and will be regulated. I wanted to recall that in 2024, additional funds that were given to the budget were over 25 billion, and within the funds over unlimited were exercised until the end of the year 24. At the local level voivodeship, we run operations which will give all settlements for those services that are given in priority, for the ones without a limit for the 4th quarter. We end the work for the end of February. The budget for this year is over 29 billion higher than the one that was originally planned for 24. So we are growing and increasing the funds. The NFZ is working based on a sustainable budget, which is obligatory from the point of view of the law. We do not hold any additional incomes. We have defined rules that we function within, and if we do have such unexpected surprises that you know about, well, then those disturbances are witnessed, are inevitable. I can only say that we keep our fingers crossed, and the reform that has been introduced by Madam Minister, the NFZ is really the one that really wants to have the best solutions ever. We keep our fingers crossed, and we rely on your support and you endorsing Madam Minister, because this will give a rationale expenditure for the funds that we hold. Thank you very much, ladies and gentlemen. No more questions can be allocated. There are so few that we have an answer to by the ministry, and few of them will be taken from the ministers to the very specific organizations addressed and given directly. And last in this panel, very uncomfortable topic, which I just want to refer to in the context of the systemic financing of the medical health services. We have discussions that perhaps as patients cannot take any position, but still, as some of you know, immoral. I agree that law on the lowest remuneration in the healthcare services, which is really drainaging the budget for individual entities in the system. It is not a word against the higher salaries of the medical staff, but this is totally unethical to me. Such diversification by the payment of the medical and non-medical staff that is also working in the hospital and cannot rely for the annual July pay rises, same as the medical staff. This is becoming unethical. And I think you will face such solutions that will be given, because in the medical services sector everyone is aware and they agree that we have to speak loud, stop with increase in the medical sector. Regular July increases several percentage arising from the calculation and ratios. This is translating the financial state. This is not giving a good support of the administration that is unfortunately being deprived of. I know it's not popular what I've mentioned, but I think I should also remind and recall this topic. Thank you very much, all ministers, professors, all of the panelists. Thank you very much. Now technical information. I would like to invite you now for a lunch break and the first international panel about the threats in the medical sector services in Poland and Europe. You're welcome to that panel after lunch, and hopefully you will be able to participate.
Ladies and gentlemen, I would like to welcome you to the first international session of our today's conference. Speakers, the panelists, please take seats which you like. We have no special designated seats on the stage.
zaczynamy po tak zwanym dżingiel, więc ja czekam na dżingiel.
We start when the special signal. Yeah, here it is.
Czy mogę już Państwa teraz oficjalnie i głośno
Now, officially, I would like to welcome you on the first international discussion panel. We are going to talk about external and internal threats to the healthcare system in Poland and Europe. This session is being transmitted both in Polish and English. One of our speakers will use English language, so if you need translation interpreting, please take the special sets. I would like to greet Adriana Borowska, Madam Minister, Minister on Civil Society, Valeria Hrynewicz, representing the National Institute for Medicines, Joanna Ladomirska, Médecins Sans Frontières, Doctors Without Borders, Professor Grzegorz Gielerak, Director of the Military Medical Institute, Dr. Adam Nowinski, Institute for Tuberculosis and Lung Diseases.
Dzień dobry. Rozpoczniemy naszą dyskusję o zagrożeniach, których przed
We will continue on discussion on threats. I wrote down 5 threats, and I hope that we will have an occasion to discuss all of them. But first, I would like to give the floor to Dr. Eliasson to make an introduction.
The good news is that Bogi will talk without any PowerPoint slides.
Can you hear me?
Yes.
Thank you. So at university I learned if you got no point, use PowerPoint.
Yes. So you have plenty of points for today.
I have several points.
Yes.
Very good. Thank you so much for inviting me here. I think it's a pleasure to be at such an event which is really centered about patients, really about what we need to think about when we think about health. And in that, we should also be very aware of that we have achieved a lot over the last 150 years. Sorry. We have achieved a lot over the last 150 years. Our average lifespan used to be 30 years. Now it's reaching 75, 80, sometimes a bit more than 80. But as you heard today, there are so many things we could still do. And the thing we really need to focus on is that it doesn't require more innovation to do much better. We already have technology and knowledge to do much, much more. So it's really about rethinking how do we do things and not just dreaming about the big next thing. So the way I'm working is really to restate the mindset of how do we think health as the most important societal pillar? So what happens when health is something that you do to keep people healthy and not something you do when people are not healthy anymore? And it requires much more changes than you think. So it does require a new paradigm. It does require that we rethink who should be part of paying the health system. It does require that we rethink what are the players and how do we work across countries. It also requires that, for instance, patients' organization work much more together and also take a responsibility on building the next paradigm. So if you go back and you look at the system of today, they're breaking down, but you never had more money, you never had more equipment, you never had more knowledge, and still it doesn't work. So what is it we should do? We have worked quite hard in one of the projects I'm leading, Nordic Health, in saying, okay, how do you move so half of the budget becomes preventative, primary, secondary, and third-year prevention? What does it take? Because it's evident if we just continue as we are doing today, the system is going to break down. It does not work. So the real question here is, how do you reduce the disease burden? Not how do you deal with disease burden when it's almost too late already. So it doesn't mean that we shouldn't treat. We still need to treat, but we also need to think long term on how do we reduce the avoidable disease burden. Our systems today are built for accidents and communicable diseases. Our challenge today is 85% chronic non-communicable diseases. So how do we make that change so we really go forward? We, of course, on challenges. Our global health solidarity is apparently falling apart. So what is the role of Europe? What is the role of Poland leading? What is the role of Poland being the biggest country in the former Eastern Bloc? What is the role you have really in being a part of building a European approach? And of course, Denmark has the presidency afterwards, so how can you work together on those things? And there are some things which I can elaborate more on when we go in, but in Denmark there is a health reform now really moving things out of the hospital and closer to the patient. And it's also about one of the areas that we have worked a lot with, COPD. COPD is the most expensive disease in Denmark, even if it's not known. It's the third biggest killer worldwide. And it is expensive because it's horrible for the patient who are ill for a long, long time, for decades, cannot live, cannot work, cannot exist. So this is really about dignity. So if you put dignity in as a cornerstone, how do you go forward? So to me, when we talk about challenges, it's not about how do we repair this system. It's how do we learn from what has worked with one size fits all, and how do we then build a combination of personalized health and public health that really can be more precise and early in how we help people. So this is about keeping people as healthy as possible for as long as possible, also when they have a disease. So thank you very much.
Thank you very much. Dziękuję bardzo. Pan doktor jest z Danii, więc myślę, że zwłaszcza doświadczenia dotyczące duńskiego systemu ochrony zdrowia, który w Polsce od jakiegoś czasu...
The achievements of the Danish healthcare system. This is a very inspiring system, and we are very grateful that we are having this opportunity to have Dr. Lyson here at our panel. First challenge I wrote down is the aging society. The system of the healthcare becomes more demanded, and it demands more attention. And it deserves to be expanded or reformed. I would like to ask Madam Minister Adriana Porowska how our society, our healthcare system is preparing for this phenomenon of aging society. Ladies and gentlemen, in our government there is a minister who is in charge of aging citizens. We have less birth rates, smaller birth rates, and we live longer life. Before, in the past, 60-plus person was an elderly person. However, now 60-plus is a very active person who is eager to live actively and long time. We have councils of elderly people, we have NGOs uniting elderly people. We have a lot of elderly people who are active on the labor market. It demands a lot of investments and change of mental mentality, mental set concerning how the society should integrate, should be prepared better to integrate elderly people. I am also overseeing the National Freedom Institute. Please visit the website of the National Institute of Freedom. We are invited to take part in the public consultations on the draft laws, on different strategies aimed at tackling challenges. People who would like to invitations for people who want to be active in creating such strategies. You should also remember about all those things who may happen in the healthcare sphere and care sphere as a whole. And I think that non-governmental organizations will play a very significant role in this sphere and provide care, better care and more care to other society members who need it. The next thing we should remember about is that in general, elderly people living in cities looks different than life of people in small towns and villages. In many of such places, non-governmental organizations conduct different kind of community clubs and organize free time of elderly people. And they say that the care of elderly people looks different. And here we count on the support of local non-governmental organizations. This is the best way how to reach out for those people who need help. Also, representatives of our government visited many of such programs. And you mean that this is one of the ways of bringing together different social forces, volunteers, not waiting for the government to do something? Yes, we have more retired people, more elderly people. It concerns not only Europe, and we should know about it and cope with this. Civil society organizations, volunteers, and all the initiatives that they are providing. Even elderly people also are ready to offer their support. This means a lot. Myself, before I became a member of the government, I worked in the civil society organization, and it was the moment when the full-scale invasion started in Ukraine. And our organization, many other organizations, did a lot. Offering support to refugees, caring for the kids, providing meals, and we involved a lot of volunteers who joined us in these tasks. And the other thing is the next phases when all these people would need an individualized, personalized care, depending on the area they live in. As I mentioned, the situation looks different in cities and in a rural place.
These demographic changes, Western societies are getting older and healthier and older. And what did you do in Denmark to face this?
Yes, this is working.
It's okay.
So yeah, the Danes are also getting older, so what is happening now is that you have a squeeze from several sides. Firstly, it's very hard to recruit additional people to the social and health care services, and partly you have a huge part that goes on retirement. So that's one side. And then you get a bit older, but the disease burden itself is also growing. So this is really about going in and seeing how can you work with more precise early detection. So the new Danish health reform is to work closer to the patient with the local environment in order to catch especially the chronic diseases better. And we should remember that most people who get one chronic disease also get a second and a third with time. So how do you, and this is not firstly about the system, this is firstly about how do you make this best for the patient? And then that becomes better for the system. I think that is very important. And then when it comes to what Madam Minister is mentioning about the voluntary work of seniors in the society, so Denmark is has always been, or at least for the last many decades, very much based on civil society, and you have a structure for how you activate all from youths to elderly. There's a lot of support for it. There's a structure for it. And I think that is one of the pillars of a stable democracy, that you have a civil society that also pushes towards the more formal politics in that way. So those are some of those things. I think there is now a huge focus also on, for instance, which was also mentioned, that loneliness is a bigger challenge than we think. So by activating elderly people, you actually deal with two challenges, not just one in that way. So I find that very, very interesting in it. But when it comes to reducing the disease burden itself, I think we all have a challenge. I mean, we have some ideas on how to do it, or what to do, but actually how to do it, because this is not just about what happens in the health system. This is really what comes in from outside the health system, and that's health literacy. It's really teaching from school age. So, okay, we might be able to reduce smoking, but can we get vaping out of the way, for instance?
Thank you very much. Bardzo dziękuję. Jednym słowem, pan doktor potwierdza tę potrzebę budowania organizacji pozarządowych.
Very much we see confirmation of the involvement of the civil society more and more, but now we plan the other challenges relating to the migrations and biological challenges. And now Dr. Joanna Ładomirska, who is organizing NGO, Medicine Sans Frontières. If you could share your opinion on the management of the prevention and management of the services, the Doctors Without Borders, maybe epidemiological challenge. I would not combine directly with immigration, but with a globalization in which we are already exist. We all are moving a lot. We fly to different countries where different diseases are present. Well, globalization would be the key word, especially in context of the latest pandemic. As an organization, we have to remember that in context of immigration, the greatest problem is related to the southern hemisphere, where we have millions of people moving. The greatest problem is in Sudan, where there are millions reaching neighboring countries, and those reach new place of domicile. They are undernourished, they have no access to hygiene. This is an excellent Eden for communicable diseases. We are not speaking about those diseases, but we have to speak about measures and medications. Those people are diabetes and they need, for example, insulin. We have children being born no matter where their mother is at that time. And there are other situations in which we are facing other problems when we speak. Not only they go to the places where the system of healthcare do not exist, or the systems cannot cope with the challenges faced, and hundreds of thousands of people are not being able to be tackled. We speak of stigmatization, discrimination. Those people would never enter into the mainstream system. They will. Health would not be the first, like a priority on their list. So we speak on prevention here. How to counteract the epidemics. When we have large groups of people, we have to think of the hygiene. We have measles, which is the most important communicable disease. It really can kill many people. Measles is the major disease. It is very good for malaria to develop. It does not mean, but education is another element. People should not be afraid on how to use mosquito net. Also, mental health. Many of them have a trauma. All this is not very good. It's a problem. We need resources. An excellent example is with your organization and the pulmonology hospital. Why doctors from Médecins Sans Frontières and from the Institute for Pulmonology and Tuberculosis? Yes, we are an organization of offering medical services. We work predominantly in Africa. We appear in Poland due to the war in Ukraine. And because we have an experience in many diseases, this is tuberculosis, something that we already had forgotten in Poland about, but together with the Institute for Tuberculosis, and we try to offer services to those who reach Poland from outside. What is the role of your organization? You said you combine your roles. What did you offer? First of all, what we did was to offer our medications, because in Poland there were no medications available. We were treating tuberculosis the same way as we treated in India several years ago. There were no other new drugs existing, and now we are supporting in a way that those medications would reach those that need them, and to be sure that we have the right response. Of course, we are trying to build on the potential. We have a panel of Consilium that is giving technical backup, and okay, you have a partner. We have a Dr. Adam Nowinski. If you could share from the Institute of Tuberculosis and Pulmonological Diseases Institute, how you organize the pilot program, the program for the drug resistance in laboratory scenario. How did you manage to collaborate with the organization of the Médecins Sans Frontières organization, and what are the conclusions driven for the system, for the Institute? Thank you for the question. Yes, we need a better share of the mic. As a colleague mentioned here, Europe managed to tackle tuberculosis pretty well. We have several thousand of tuberculosis in the EU, but globally over 1 million people die for tuberculosis. Asia and Africa rates are pretty higher, and we did not face such problems that we were not holding such difficulties that with the new wave of the refugees from Ukraine, with the support of the Ministry of Health, that held a special pilot program that was to address all the issues related, and in that group we had the WHO, Ministry of Health, and Instytut for Tuberculosis as a coordinator, and also Polish Society for Pulmonological Diseases. There were 2 or 3 NGOs. Polish Society and Medicine Sans Frontières and WHO are in a way NGOs, because we, in fact, are a scientific organization, R&D organization, but we've been coordinating the program, but the knowledge and know-how combined allowed us to manage and tackle the problem and to introduce the novatory measures to sort out the problem. We tried to be probably what our Danish colleagues said, openness to a patient being a key element. The epidemics, we're facing this problem. We have a problem which is rather flexible in the situation. We try to treat people in an ambulatory system, both women and children jointly, not to have rather inclusive system, introduce certain solutions that were novatory, medical. We introduced for all doctors who held problems with tuberculosis, multi-drug resistance. We never had such problems. We always had good outcome of treatments with the resistance also, but we didn't have patterns for treatment in that area. We had to take foreign patterns, so we also had some donation of medicines that were included into the system. We had also other methods that allowed online to combine with our mentor, who was observing the treatment regimes and also monitoring. We were laughing that it should be in tuberculosis something to be easy, but it should be thoroughly treated, and the drug resistance was arising from the improper and bad treatment with the antibiotics. We are in the pilot still, but with the very end of that pilot, perhaps September or August. And do you know what's going to happen next? Yes, in September we complete the pilot, and within the Ministry of Health we agreed on a new program of the prevention of tuberculosis in Poland. The program will introduce all of the methods and novatory approaches that allow better treatment of tuberculosis, the entire population of patients. We also spoke of the shortage of drugs. The problem caused too many paradox situations. The pattern of 4-month treatment, but in Europe we are forced to treat for 6 months because we have shortage of antibiotics. We have shortage of one key antibiotic, which if introduced would shorten down from 6 to 4 months. But we have a problem here because the 4 treatment treats only $2. So no entity is interested in introducing such a drug pattern to the entire EU market. So without the public support in the process, hopefully Poland and Denmark and other countries under the presidency of both would have the conditions in legislation that would support financing the drugs those that are cheaper, those that allow for treatment in more rational manner. Yes, thank you. What you're saying is utmost interesting, but before developing and searching on the drug resistance, I would like, before giving floor to Professor Hryniewicz, I want to say that something roots down is developing, giving floor to the state to arrange a policy on health, but exercise through 3 years down at the roots level. So the government has been functioning in the pilot program from the very beginning, but very open manner. It has been offering way to take new measures. So now, Professor Hryniewicz, you are asked to address the drug resistance, the National Institute for Drugs. We are discussing a phenomena of the seasonal epidemics of flu, where it unburdens this health protection system, and it's a great challenge for epidemiologists. How should we prepare for this? What should we do not to overburden the system? Well, the protection from flu, but from the antibiotics. And here I want to refer to the recommendation that the aging community has more flu infections, sometimes not fully developed. Sometimes they should be better and well diagnosed, not burdened by other diseases and unwanted effects. So we have to remember with the new treatment patterns and drug patterns. You have to remember, we all often forget, the most important problems is the change of climate. This is the climate warming and the pathogens, flying pathogens and vectors from south to north. We see in Baltic, we've never met parahemolytics, which is the flesh-shooting disease. Nobody expected, nobody relied that something like this can happen, and we are unable to recognize. So we have to adjust with our methods in the studies and research. The biology, molecular biology, is developing so rapidly, and this is due to the great charity orchestra that they have excellent laboratories. I don't know if they always hold funds for this, but they are able to hold a diagnosis rather quickly, because this early warning systems is something that we really need to have to communicate across the country, but also across the border within the EU. We have the networks of reference laboratories that we work also with Denmark. This is one of the main countries where we collaborate with in that area, so for the antibiotics. Now, the problem is that there are shortages, what was shown by the pandemic of COVID, and majority of our primary substances come from China and India. Therefore, we should be pretty fast looking around for other sources for the primal products, because if something happens in China or India, politically or not, would we have an access to those substances that are secured for production of those drugs? Now, we of course see shortages in the drugs and medications. We see a new document being developed in EU, which is the essential list of the drugs that would be insured and protecting. So I am really, again, bowing from before Denmark, which is really using drugs, antibiotics in such a manner and safety with the resistance in that context, because the system is allowing to limit down, narrow down the Poland. Well, it's not really too much to speak about, but maybe to vaccinations now. Let's go down to that path. When we talk about tuberculosis, this is something we should not ignore. It's a very hard to treat disease, but East Europe has problems with carmopazans, which are the components, and we are leaders of selection. We have problem. We have certain progress in that area, but I don't think our system will be allowing for more of those non-fermenting agents. Now, we are talking about lung diseases. Yes, of course, we reached an access and a new vaccination of new generation of vaccinations. We've been far too long for 10-valent. Now we have multivalent, 20, 21-valent or 30-valent vaccinations, and the referential center in our institute observes a drop down of morbidity and the level of the resistance to the drug. So this is important. This is giving more effective treatment results, and that is miracle of vaccination. And we see that meningococcus and hemophil bacillus and other, from the introduction of vaccine, we have no one meningitis strain to be observed. Now, in our system of vaccinations, recommended and mandatory, that is also financed fully. This our system, is it good? Is it optimal? Or should we change in any direction? Our system is good, but the recipient is poor, is bad. So education is the key word. Yes, I've been given calls from mothers when a doctor said it's better to go through natural way rather than take a shot of a vaccination. So what happens if, education is missing or is in shortage? People need to be more educated. We have shortages in that area. We are taking time, we give money, but this is what we need. We have products, we have vaccinations, as you mentioned, yes. Maybe antibiotics are in shortages, but vaccinations are in pretty good condition, quality. They are combined, they are in different patterns, and all you need to do is take shots, and that's all you need to hold. And then when we refer to the health education, we are discussing education as an issue, but also challenges relating to those immigrants from the war. How do you perceive the management of the migration from the health care? Has it been tackled, corrected? Does the law relate to the public health? Do we have a good system in legislation and organization that Poland is resistant to the challenges that are faced? Yes, I will give you an answer. In the meantime, I want to say thousands of things, but there you go.
Ladies and gentlemen, I've worked for 20 years in the organization, civil society organization, working with homeless people. And I know that many organizations have done a lot. Dr. Madalinska, pulmonologist, collected funds to provide diagnostics for those people in homeless crisis. There were different initiatives involving doctors, and out of our target group, many were migrants. And I know that many activists and civil society organizations are involved in education and prevention. I myself first was suspected having TB when I was pregnant and when I was working with the people in homeless crisis. We also collected funds to provide tests and for our beneficiaries. I believe that the involvement of civil society organization is needed. This organization has done a lot, provided support to those people in clinics, on the streets, and they are capable to work on the territory of the whole country. Although now this work can be done normally without extremes, but this is stable work they are doing. And now, concerning migration and increasing number of migrants in our country, we notice that we have to do more work in terms of prevention and education. And without civil society organizations, is not going to be effective, because only these organizations have trust of the people and can reach out for this hidden or not obvious groups. How can I help you? Could you trust me? Provide vaccines for the children, explain how to do it, explain how prevention is working. So the strict cooperation between the government, local government and civil society organization is crucial in this regard. So we know 3 years ago war in Ukraine started. Many people relocated to Poland. These people were with poor nutrition, with a huge stress. They were kept in huge shelters, used mass transport. They did not speak Polish language. So to say, huge problem. The Ministry of Administration in Poland announced the call for proposal for integration projects for migrants. It envisaged also huge, big component of health education. It is widely discussed. We are talking also about health safety in this context. Most probably all of us will agree that we have to individualize care. System of monitoring of health of migrants and vaccination should be in place, provided by government, but also we have to pay a lot of attention to reaching out to people through civil society organizations and supporting them in this work. Since you are talking about safety, Madam Minister, and also challenges related to our presidency in the European Council, I would like to ask Mr. Grzegorz Gelerak, General Director of the Military Medical Institute. How you see these challenges in the safety of our country, also in terms of medicines, drugs, vaccines, and also other resources available for the healthcare system. So this is the number 4 I wrote down for myself. It is safety in terms of medicines. Is the safety enough for the needs in Poland now? The safety in terms of medicines is a wide topic. So I start from the times of peace, how I see threats here. I think we lost the thread what safety is. it is hard to answer what we expect from the system, but this system is evolving all the time. It is changing, and these changes are based on the technological progress. And we see now, and those who are managing the system see that the system starts lacking just finances, financial resources. In 2016, Deloitte company conducted the assessment of the OECD countries. It showed that annual growth of expenses on healthcare is 1.6%. It shows that every year the country would generate deficit. It was a very clear signal showing that in this formula in which we are functioning now, we would not be able to sustain the level of expectation and aspiration in terms of healthcare. And we came to this point. Denmark and the Netherlands have changed their approach to tackle this challenge. This is the historical data. July 22 of 2022, this group was joined by England. They announced the reform of the healthcare system. And if we look at all these countries who have decided to reform their healthcare systems, I would call this, using just well-spread wording, it's a inclusiveness of stakeholders, so to say. This means just to use all resources available on the market, private, state-owned, local government, patients, civil society, leaders, opinion leaders, and everything what is available to change the concept of what health is, how we see it, and what does it mean to effectively manage it. How to bring and associate all available resources. How to use all these resources effectively. Safety in terms of medicines in Poland. Poland provides only 22% of all medicines. If we compare with the other European countries, this is quite a low place in the rank. Poland ranks quite low. The next, Italy, Great Britain, France, Germany are higher. It means that they produce 2 times more of the medicines and active substances than the demand of the country itself. There are areas concerning concrete drugs, pharmaceutical drugs, medicines from the point of view of a given society must be in place, provided by the government. And it's very good that recently the list of the critical medicines have been published. In Poland it's 300, in the European Union it's 200, and it's very good step forward towards the safety. This is the safety what you mentioned, the medicinal safety of the country, and I would like also to add that we are only starting this path, building our medicinal safety. This is happening typically for our country. For a long time, nothing is going on, but later we managed to mobilize and make a breakthrough. And we are waiting for this moment to happen. Now, what should we do? In terms of administration, I would list 4 most important things we should focus on. Training, prepare the medical healthcare staff, human resources, training and resources, how this system should be built. Many people imagine it this way, that we should train all the medical staff in the country. Yes, it would be good, but we do not have such long time, because we are facing a lot of threats, economic threats, and time. We should focus on the area that is endangered the most. This is Eastern Poland. It means that we need a good cooperation between Ministry of Defense and Ministry of Health. It is necessary to designate institutions who would be responsible for safety, medicinal and healthcare safety, train the key staff, equip with necessary resources, conduct training, and this should be a permanent process to take place. You also named the threat, political instability and military conflict. What is the most important for today to prepare our healthcare system to tackle the political crisis and military threats? We do not lack human resources, and we do not lack good ideas. As far as the concept is concerned, we are on the safe side. When I presented my colleagues from the American Army a structure we are going to deal with this, they stated that our system is the best in the world. This is what we are having now in case of electronic banking system. Before we had nothing. And sometimes having nothing is an added value. The Americans still have paychecks. And we have made a huge breakthrough in electronic banking system. Sometimes the burdens of the past, lack of anything than the burdens of the past helps today. It can be an added value and will help to achieve our goals.
Okay, so we have nothing, sounds good. One of the things that we shortage of is the national production of medications, the essential that would be available down locally or in a neighborhood produced. Yes, for the safety of medications, definitely, and this API production. Also the support of the national system without looking down on the industry, but individual entities that produce API. But we should also be looking on the chain of the events and the whole economy, and this part of industry is in relate to the new technologies and developments. So if we invest in that area, we will have more investment, we'll have the progress in the chemistry, biotechnology, and many other disciplines that today are decisive on the position of the country on the international arena, because the new technologies and new proper management of the human resources is conducive taking the human capital from other areas, as it has been mentioned by the previous speaker, and it will give us new developments in the coming time, centuries, etc. So new technologies, equipment, new solutions, not like 3 or 4 years ago, panics to find respiring apparatus or the masks in China. Yes, this is the case. This is what we have to remember and take the lesson learned that we should remember. All entities being part of the system of the safety and security, being equipped with the proper knowledge about the equipment, tools, and education to offer the support, but also to have a proper system. Just to give an example from the pandemics, which we did not use, was an issue of the structures of the module hospitals, one at the military hospital being still functioning, not treating patients, but we are using this modular system for trainings. But this is the only place for a mass situation to offer within the voivodeship of Mazowsze, Warsaw, 60 or 100 people. Over 100 people that can offer the solution. This should be ready for all regions of Poland, especially on the eastern borders of Poland, especially for those inflowing illegal migrants that come. We know that they are constituting certain epidemiological threat, quoting the media. Hajnówka hospital paralyzed by immigrants, for example. This is the media announcement from the press, local press, because they are constituting a threat. But in a clever country, hopefully we are one of them, being creative as well, we are able to get ready and be prepared and draw conclusions and experience from the past. Thank you very much. In that particular instability, there's one more question, which is for cautiousness without a representative of the government or state of the institutions, but from the NGOs, organizations. Maybe you could address the issue. Decisions that are taken in the United States, that rather radically there will be a translation of the approach to WHO. WHO will be remodeled. It's not only that the United States will not pay its fees, but other stakeholders working on WHO reform. The financing would be more stable and not voluntary, but we could build on certain structures. Maybe this question will begin just to Dr. Joanna Ładomirska from Medicine Sans Frontières. When you see from the point of view of your organization, you've been witnessing with WHO joint projects and financing. So can you say a big risk to those problems that may be faced with the budgetary problems? Of course, this is a major problem, not only for WHO, for other organizations that are part of the funds running from US aid. US aid is already closed, I think. In theory, yes, but one of the judges has stopped its functioning. We speak of the tuberculosis drugs, such structures that is purchasing drugs for tuberculosis. It has been closed down. We don't know what will happen next. Another organization that is treating HIV patients, over 12 million, all has been stopped in the camps for refugees. So we need water and staff. UNAIDS had to pull out, and many organizations where we work for, we try to map down what is happening, and especially in the unexpected situations, we are unable to do everything on our own. We need support of different organizations. They all hold their role. Important organizations are disappearing, and then we face a chaos. Yes, and this is happening, and more crisis, so lack of stability.
Hello. Yes, so I mean, there are big changes, no doubt about that, but we also need to ask ourselves, why does one person taking office have such an impact on us? So this is about resilience. and long-term resilience. So sometimes we also, I think what we really need to learn is the difference between acute and non-acute. And we of course, we need to deal with the acute questions all the time, but if we don't take time to take the non-acute questions, we will end up doing 95% acute. And this is the change that we really need in health. So resilience is about being able to anticipate. And when you look at, so just one funny story. Before COVID, the Northern European countries were laughing at Finland because they had so big a stock of masks. But during COVID, nobody laughed, right? So there are, health is not lean management. So what you do inside product lines of health might be lean management, but health itself is not lean management. So this is a different way where I think we really need to look at, okay, what are the challenges at hand that we have here, and we need to really rethink. And here, to me, there is one core question for you as Poles in this. You have the presidency now. There are huge challenges. So do you, with Europe, take a part of this responsibility? So, and you could say, okay, what has that to do with the health of the individual in Poland? Maybe not today and tomorrow, but 5 years from now, 10 years from now, it does. I fully agree on these huge challenges that we need to help those most in need. But if we are not handling those who could take better care of themselves with a little bit of help, we don't have the energy to help the weakest. So it's not an either or, it's actually how do we make this? And I really like this comment about when you start from scratch, you can actually leapfrog. And I do think that in digital health, you are the biggest country on the eastern side of Europe. So volume matters. Is it easy? No. Would you need to connect data in totally unprecedented ways? Yes. Would there be a lot of ethical challenges? Yes. But ask yourself, when you want to work with health and data, is it about protecting data or is it about protecting the citizen and the patient? And if you want to protect the citizen and the patient, you use data, and then you figure out how to do it. So what we are missing in the discussion is not exactly what do you do on granular things, is how do you go in and define the playing field so you can work with industry, so you can work with different countries, so you can work in Europe, outside Europe. That is the real discussions on safety and security, and then you have the other parts in it.
Thank you very much. Szanowni Państwo, chciałbym na koniec wrócić do piątego.
Thank you very much. Going back to the fifth challenge that was mentioned by Professor Chyliniewicz, which I noted down is the environmental challenges and climatic and environmental pollution, which we are witnessing, the soil, the air, water, microplastic particles, both as well as in our organism. Who of you would like to share their opinion? Would Poland is, as a community society, do anything in that area? Maybe it wasn't exactly this, but I just wanted to underline Poland, unfortunately, and I'm really regretting this, is a country with the lowest level of funds for education, for science. So we have to invest in science. This is something that would strongly be put on the table. We witness the problems. We have about 30% of the funds, resources. We need technologies, new treatments, new diagnostics, and science in Poland is not very popular, unfortunately, and this should be heard and spoken loudly about. But we have, luckily, the Instytut for Tuberculosis and Pulmonological Disease. Now, you are able to tackle this. Who else can do this? Yes, air pollution is a great major problem. Also, chronic diseases of lungs, which are a big problem of the public health system. POHP, this is directly related to the challenges of the climatic. We are witnessing this challenge, finding certain consensus of going towards the green energy and having an impact on the public health. From my point of view and pulmonologist, air pollution is a key element of many respiratory system diseases, cardiovascular system, and I'm full of worries that this consensus of the emission of carbon dioxide would have an impact on the public health. I'm afraid I see some threats still coming on us. Here I can add maybe with the climatic changes in that reference, the world is changing. Professor mentioned the vectors are also changing. We have mosquitoes in Europe with malaria and dengue present. We have unfortunately lack of knowledge and no medications for that. So it's not only innovatory but old medications that we still do not have and possess in Europe. Perhaps we could use with the Polish presidency, we have a review of the pharmaceutical law where the medications should be critically reviewed and are crucial for the public health, and they are not interesting for our market. Maybe instead of regulations, we should produce more medications. Yes. So, regulation will allow to import drugs that are not interested to anyone to be registered. However, they are requalified by WHO. Millions of people are being treated with them. They are even arriving at the ports in Europe, but here in Europe we have no access to them. We also had 2 more items. Yes, I wanted to support my colleague. I think for the safety of the drugs in Poland and our broader stretch in Europe for dengue, for malaria and other tropical diseases, we should have storage warehouses full of medications that should be used in 90%, and vaccinations, yes, and to be utilized when they are unwanted.
This utilization of expired vaccines is a question of safety. It is supported by the example with TB. It is very crucial for medicinal safety. And now about environment, not strictly environment as we know it, but our European environment, medicinal settings, COVID pandemics launched, caused that a number of programs were launched aimed at improving medicinal safety. And programs for better logistics in terms of medicinal distribution. Maybe it is in our interest to improve, to invest in the environment. It is our advantage. Europe is an institution, European Union is an institution based on the 4 principles, guarantees to us all that we are we're a society capable to compete with other economic strong societies, economically strong societies. Madam Professor said about under-financed science in Poland, although they are growing. In the United States, it is 5% of the country's budget. In China, is over 20. We are now talking about the situation, the world, we should look at our place in the world civilization, where we are, what we can do to improve our position. In terms of environment, production of medicines and active substance from Europe were transferred to India, China, due to environmental standards. Thanks to this transfer of production, we have better air, but also worse economics, less taxes paid in terms of for this production. What is the major threat in your opinion? Demand a priority approach. What we should focus on and what the government has already focused on. Ladies and gentlemen, it is clear that the pandemic and the war in Ukraine showed us how many things we can have no influence on. One morning we woke up and saw clearly that our safety has been jeopardized. Several years ago we thought about history. We could not imagine that we would be immediate witnesses of what is going on just next to us, that it would concern people, our neighbors, who lost everything. This crisis, and I put a special focus on it and stress. We spoke about it in times of pandemics and also towards the situation of our neighbors. The Ministry of Defense, Minister of Social Affairs and Administration, and my ministry is working on the new law on the civic defense. This will ensure that our society will be able to support the government in tackling the crisis and supporting people. And I think that there will be a huge role of all of us, civil society organizations and government, to bond partnership to provide medicinal safety and to respond and reach out to every individual, all the threats and diagnose them and respond. So this is very important task for all councils and panels working with ministries, involving leading experts in several fields, and see how many challenges we are having. We started from local hospitals and now we have switched to science, civilization diseases, diseases and problems related to migrations and environmental problems. You will also hear in the coming weeks about solutions which will not only be our national solutions, but also those solutions introduced together in partnership with other European countries. If we are capable to make our common gas storages, because we decided that it would be cheaper, more beneficial, and improve energy safety of European countries. I think that similar approaches we can adopt in terms of storaging of medicines, for example, against tropical diseases. And I think we will have such practices in Europe. I also noted here that there is a panel working at the Ministry of Health has mapped this program and will pass it directly to Madam Minister Izabela Leszczyna. However, we should focus not only on the government, but also on our society, on all of us. Please, I invite you to the website of the National Freedom Institute, and there is an invitation to take part in consultation about how to involve local leaders and civil society in tackling the crisis, all those challenges that we cannot foresee, how we could help each other. Thank you very much. I think this is a very good wrapping up of our discussion. I learned recently that what we are discussing here and what we discussed in our publications also being discussed in government. Thank you very much, Madam Minister Adriana Porowska, Bogiela Eleasen, Director of Health, Copenhagen Institute of Future Studies, Adam Nowinski, Joanna Lubomirska, Grzegorz Gierelak. Thank you all. And I invite you to the next session.
Dobra. I teraz wiecie panowie, że
Okay, ladies and gentlemen, I greet you very warmly. This is the international session number 2, the health challenges for Europe, the role of Poland in the future of the healthcare in the European Union. As you know, Poland is the chair, is the Polish presidency of the European Council from January to June. I would like to greet our panelists. Our participants is Katarzyna Anna Kasperczyk, Under Secretary of State at the Ministry of Health, Stephanie Alexander Lewandowska, National Consultant in Child and Adolescent Psychiatry, Marta Pawlowska, the Director of the Partnership in Treatment of Obesity, Bogi Eliasson, Director of Health, Copenhagen Institute of Future Studies. We know Bogi Eliasson, who was a participant of the previous session. David Elvira, PhD, Global Corporate Public Policy Head at Sanofi. Dr. Piotr Jablonski, former Director of the National Center for Contracting Addiction. Institute for Patients' Rights and Health Education, Igor Jesiak, Stephanie Kramer, Jakub Adamski, Director of the Cooperation Department Office of the Patient Ombudsman. General Gerelak said that Poland shows in the European Union that thanks to low financing, that with little money the country can achieve more. So I would like to say that I would like to show, to stress what effects we can reach with a scarce budget.
Czyli 3 razy, proszę Państwa, mniej wydajemy na głowę mieszkańca. Gdzie Czesi wydają 2278 euro, czyli 2 razy więcej niż Polacy, a Dania 4154.
Denmark is spending over 4,000 euro per person. Poland is about 300. Czech Republic is spending more than Poland. And I think we can start the discussion from the point of view of the patient, how the situation of the patient can be improved, taking into consideration that health has not been a priority of the European Union. So the European Union interferes in the national policy. How the voice of the patient could be heard better, how we as Poland could promote our health achievements. We achieve good results in certain spheres. However, at the same time, our public health care system offers very little money. This is the perspective I would like to discuss. And what European examples we can use. Ladies and gentlemen, this is my privilege that I do not have to discuss about financial aspects of the healthcare. I would like to add, I would propose not to compare the systems of different countries because the systems are very different. There is a different set of guaranteed services in different countries. Of course, I do not deny we can always increase our spendings in the system to improve it. However, this just simple comparison does not consider specific features of the healthcare system. I agree with General Gerelak that in Poland we managed to do more with less money. You know that with more money in healthcare systems in other countries, patients do not get more. Of course, every system, our system, as every system, has some shortages too, and we do our best to analyze it, discuss it, and make attempts to improve this, to meet the challenge. And the challenges are similar to those in other European countries. What is important in the context of the health policy, which is taking place here in European Union, is absolute change in the focus in European Union. The member states have competences to decide how to formulate the system of healthcare. After COVID pandemics, this situation has changed. There was a united effort for healthcare in the whole region. I also took part in European bodies and in the former Polish presidency, and there the healthcare issues were not one of the most important priorities, unlike now. Now healthcare system is more important topic in international discussion. Also, during the recent years, we have developed a number of initiatives. We call it the European Union for Health. If we look more widely at the challenges in the European Union, we will see how citizens of the European Union see health. They point out bureaucracy, for example, as one of the challenges. Perspective of the patient, a person is somewhere lost in the midst of discussion about regulations and directions. The main goal of the Polish presidency in the sphere of healthcare is the discussion of the future. Wherever and whatever we discuss in this regards, the patient is the most important, the patient first. We have started discussions and in the European Parliament with commissions. We started doing it in 2024. And actually all the time the patient's perspective was the central in our work. Besides the general discussion, we want to involve not only the perspective, but also patients' organizations in forming and implementing strategy. The Council of Ministers decided to involve patients' organizations in work on the new healthcare perspectives. As you know, patients' organizations were very much involved in formulating priorities. I myself also was in touch with these organizations, collectively and individually. We do our best to involve the civil society in this regard to our work.
Especially those two priorities relating to the prevention and challenges towards youth and adolescents, they are to a large extent focusing on the patient's needs, and our consultant, Dr. Lewandowska, may share with us the priority for the mental health of the youth and adolescents. All the stakeholders are considered. We on the panel of the adoption on the mental health of the youth and adolescents. We've been writing down those different elements together with those groups of peer. Now, I must say that those younger people who were supporting us, I was really very, very much surprised with the added value with what they have shared and what we can present as an end product. One of the examples where we really hope to have the patient's perspective is the post-medication out of the report on the competition in the EU in the area of the medications and distribution. What is important, we should be supporting innovatory and new therapies. It is important the prospect of the access for the patients in the physical and economic area. When we speak on the competition, we have to remember what should it serve. Not an empty notion. In the end, the beneficiary is a patient. And when we speak on the series of regulations and revision of the pharmacological package, and in the coming weeks, new drug on the critical medications, all this jointly with the common countries, the EU, we would envisage the safety of the patient, accessibility, availability of new treatments for medications to the patients. And with the discussion with the member states, I can say that this perspective is full of understanding, met with understanding, and the compromise can be reached. So hopefully we'll have this. Thank you very much, Madam Minister. Excellent examples here. Speaking in the EU, we tried to define the Polish products that could be an export product for us to be proud of. In the last decades, the Council of Patients and the Ministerial and the Ombudsman is a product which has been implemented, which proved itself. Father Nowak has spoken on the next meeting on Wednesday, where you will be discussing further different issues. And Director Adamski, I would like to ask you, the Office for the Ombudsman, which is like a business card for the patient's voice. Minister Chmielowiec was saying that you should contact us whenever you have such a need. Now we have the Roots Down initiative. In 2002 of the initiative, European cards for the patients that with 14 different rights, one prophylaxis, our priority in health care. Maybe, Madam Minister, this would be an initiative that should promote certain concept and have a card to compare the patient's rights in the EU 27 countries. Thank you for the question and for invitation. Very good question relating to the discussion was held. We are representing and comparing member states, so we are looking for indicators. Many of those indicators are those comparable, showing certain measures results. They have certain deficiency that they are not impacting the health protection, this life expectancy, when this would impact in comparison to other indicators which we've been speaking about. But what is most important here, more important to a patient, that we should understand and point out how the health protection and the patients' health measures are being assessed. I can give an example going to the patient's expectations. When we have studies on the satisfaction level, one thing is coming out. More are satisfied who are using the healthcare services, less those that don't. They don't. Once they see, once they observe, the negative is improving to the positive outlook. So the studies show that patients are trying to see how their patients' rights are being implemented. Involvement of the staff, how they are being approached, how they are treated, etc., etc., and then other measures. Now, when we look at the patient's rights, we look into 3 dimensions from the point of right of an ombudsman: the patient's rights, accessibility, safety, and the autonomy, communication, increase in understanding, dignity, privacy. So we go down to the patient's rights broadly understood and finding information, how does this look like in the full EU of the very basic rights that are acknowledged and recognized. It's impossible, and we never managed to do that at such level. So I think I'm trying to see such indicators, but they cannot show the realistic situation. So this monitoring, what was already asked by question by the doctor, is an important role. Now, another thing is, in the office of the ombudsman, we've been here others by the minister, Madam Minister present here. We were inspired about having the patient and the systems of health protection in the EU countries, how we communicate, how does the work and it translates to day, what we call it patient washing. Of course, we have a patient, but often we are not focusing on the subject or the object. So we really should use circumstances of the Polish presidency and the involvement of the Minister of Health in the issues and the Ombudsman for Patients' Rights to see the better view of the rights in Europe of the patients. We will be meeting different organizations from Europe, and we can look down on the rights of patients and how they realistically are perceived and have a better level and view on those across Europe. This is doing and can be done more efficiently within the Polish presidency. And this may have a better impact on other countries. Reading to the previous debate session of Bogi Eliassi, who has referred to many interesting things, but he has also referred to the fact that the medical data should not be used for data as such, but they should be used for a patient. So analysis of data should be used for the patient's purpose to offer the best measure to access to the services and functioning of the patient within that system. So that's where data are applied. And we have that in a priority of the Polish presidency, digitalization and ability to analyze the data, comparing the countries between one another, and expenditure. It's one of the indicators. Okay. Then your institute has prepared a comparison of the asthma and the pulmonological lung disease, which are comparable, bronchial asthma and lung disease, and obstructive pulmonary disease. Poland is on 11 days out of 21. Fourth is Slovakia. Portugal is 7, Greece is 8 with the similar GDP. So comparing the GDP to the quality of the services. with asthma. We are on the 13th position for the 21 countries. Only Greece, Hungary, and Lithuania are on a better position. How to learn? Because presidency is to compare different countries and to find the best solution, and how to read them, how to get inspired. And those leaders in the index are those to be copied, and we should use their solutions.
Yes, thank you. So, just to put this into, can you hear me? Yes. Okay, that was confusing. So, to put this into context, I think it's really important that when we want to produce data, it's about knowledge, and then we have to choose what is it we want to use the knowledge for. The reason we went to work in respiratory area and here in, especially with severe asthma and COPD in the respiratory health indices initiatives, is because these are highly neglected areas, not in Poland per se, but all over the world. For instance, COPD is the third biggest killer around the world, but it has no support or no priority whatsoever. So the start of this was really to say, okay, something is happening here, we don't have any evidence to show what is it. And it's not primarily about comparing, but it is really about how do we understand what works more than what doesn't work. And the second phase that we are building now is also to move from, okay, how do you if you see a challenge, then who does it well, and what did they do, and how did they do it? So this is a process. The first wave of working was just saying, okay, we have a challenge. What is that? And the second is really to help on how do we together solve that challenge. What is important here, and if we just take a European perspective, most of health challenges are very, very similar across the countries. You can discuss if input gives output of money, but you can also say that maybe in the future we really need to focus on what do we provide to the persons and the patients. I think if we want to solve these challenges, we actually need to abolish this binary understanding of ill or sick, because it's a gradual. And often you will have several diseases. But what we can see is that the effect of these two diseases is very big. So if we go to severe asthma, it's 2% of the asthma incidence, but in most countries, 50% of the cost, right? So normally the health system would say 2%, no priority, but it's 50% of the cost of that bucket. So this is why. So why do we then build indices? So this is not the first indices we have built. So this is really about trying to figure out what is really happening. And then it's giving a common language on how do we work with this. So again, the comparison is not about being number 1 or number 5 or something like that. It's more about how can we see what works in different countries. And then you can also go and say, are indices perfect? No, they're not. But they give an indication of what could be good to focus on and how in that way. And just because if we go back then to the presidency role here and from Madam Minister, which I really like to push on, because we need to work differently and we need to work in a union approach. I've been one of the first also to sign up to the European Health Union initiative, which was the civil society one that the old Commissioner Vatenes did after he left office. So we really want to apply data, and we really want to apply, for instance, new biological information like genomics. We can't do that in country by country. It will never work. We really need to connect that across. And your good point on what do you get for the extra money? I hope that we in the future actually take that question and we focus more on what do we get out of value than actually what do we put in. And that is the change of saying, let's have health as a value driver, not as a cost, as a value driver.
Tak, to jest bardzo dobre pytanie, co dostajemy za ekstra pieniądze, bo patrząc na przykład na finansowanie onkologii,
It is a very good example of what we can do for the extra money.
For example, financing of cardiology, 10 billion. And we should ask the question, how did we improve the situation of the cardiological patients? Danish authorities, Society of improved the situation, spending over 4,000 per person, but reduced the number of hospitals and made available information to the society about this. And I would like to talk to Mr. David Elvira, Global Corporate Public Policy Head, how to encourage countries to introduce mechanisms and to show benefits for healthcare.
Hello, thank you for the question. I hope you can hear me correctly in the room, and apologies for not being there physically.
It's okay. It's okay.
Great, super. So just trying to answer your question. First, I think we need information. So let me just repeat in a way what Dr. Boggy also alluded. Information is the way we need to make decisions. And let me just build on what has been discussed so far. That is just to share with you some thoughts about how relevant is the prevention, right? The power of prevention, especially for the sustainability of the healthcare system, for the better outcomes, and for the better economy as well. So let me connect also the dots about what is worth it in terms of investing in prevention. As we know, and according with what it was published recently, the Ambersetty report that can be available for all the audience, we know that every euro that we spend on preventive healthcare generates a return of 14 euros. And this can reach even 19 euros for each euro that we invest in adult immunization. That underscores, only with data that is not only health, it's also economy, the immense value of prevention in reducing healthcare costs, helping on what we can consider the sustainability of the healthcare system, because the healthcare systems today require less labor-intensive, models, and also because it has a direct impact on the productivity, on the economy. In fact, we know that if we maintain the health of older individuals, we can contribute to 1.4% of the GDP. Why I'm sharing all of this data? Because I think we have to help ourselves that we are in the healthcare system. I think we have to help the ministers of health of the European Union to also highlight what is the economic impact and the fiscal impact of investing in health as well. Just a point of information in that regard, we know that in the European Union, and it's quite standard in the OECD, figures, this investment on prevention, it only counts 5% of the overall healthcare expenditure. Still very low if we compare with the figures of return of investment that I share. So let me just put two examples, and I'm conscious of time, but look, we have been discussing about the chronic respiratory diseases. Dr. Boggy referred to that and other speakers of the roundtable. Why respiratory diseases are relevant when we are thinking about more sustainable healthcare systems, more preventive healthcare systems? Because look, as it was said, chronic respiratory diseases are the third killer of Europeans. And chronic respiratory diseases are impacting 36 million of European citizens, and still not in the kind of political prioritization and policy prioritization in the European Union. Diseases like asthma, like COPD, and now we have the index to assess and to compare what are the policies that that are worth investing, that are having a positive impact. And why can be also relevant to put chronic respiratory diseases more in the agenda. And now we have with the Polish presidency one opportunity to think about that and to convince the European Union that this is a topic to invest on. First, because it's the third killer, right? Second, because it impacts quite fragile population, especially elderly. And third, because also it can be a source, just connecting the dots with the potential positive economic impact now that the European Union is talking about competitiveness and how we can convince our finance ministers to invest in health. We know that if we have more better active aging and elderly population, we will be able to provide this extra GDP, these extra taxes, also to sustain our healthcare systems. This is one reason, killer. Second reason is that it impacts kind of precisely target population that it's relevant in many sense, also for equity. And the third is that also Europe has to be protected for the future. And if we think about what are the challenges that we are facing in the near future, for the humanity as a whole, we have the climate change, and we know that climate change will impact our respiratory health. Right? We know because WHO is constantly reminding us that the climate change will be the cause of approximately 250,000 extra deaths every year from the 2030 onwards. So we have to be prepared for that. And WHO is also clear on how we can manage that. Better surveillance, reduction of exposure, but also accelerate prevention and early diagnosis.
Bardzo za
let me
ten...
just-
Thank you very much
Thank-
for this voice. Ja myślę, że to jest bardzo ciekawe, że
I think that this is very interesting that the European Union has not created the healthcare plan. However, Europe has prepared the cancer plan. And what you are suggesting to create the lung disease plan. Now I would like to give the floor to Stephanie Crum and ask whether it is good time now in Europe to create a common plan for brain health.
Yes, thank you for the question and thank you for the invitation. Sorry as well that I couldn't be there, but happy to represent the European Brain Council here. I mean, quickly before answering that, we work really in the policy space for the brain, so representing patients, clinicians, scientists, and industry here in Brussels. And so that's exactly what we are working on actually together with our members and also a network of national brain councils, which is to elevate or educate and make the general public, but also policymakers aware of the fact that the brain really needs to be higher up on global, European, and national health policy agendas. Overall, not only health, but actually more broadly, because as it was also just mentioned by fellow panelists, the brain actually is not just a burden, but also an opportunity, as it doesn't just mean ill health, but also, if tackled correctly, could be an opportunity to protect future generations from the burden that we have now. So that is something we have been working on, which is talking about overarching brain health or the life course approach and prioritizing brain health throughout the life course at the highest political level in order for it to be a priority from the beginning. And so, as recommended by the WHO and global action plans, the latest one being focused on epilepsy, we have been working with national brain councils to address that specific call within the global action plan, calling for more specialized or targeted brain health plans or strategies at the country level, to address and improve brain health, but also increase investment in the space for research, for treatment, for everything encompassing the brain. And then on top of that, we believe, and we have been calling together with our members and the global brain community for an EU coordination plan on the brain in order for it to be an overarching or umbrella of all of these national brain plans within the continent, in order to streamline and synergize everything going on within different countries and to make sure that at the EU level we can coordinate and really tackle these issues all together. And so through this coordination plan, but also through a European Brain Health Partnership, which is something that is also underway, which is more on the research side and ensuring that research into the space will continue to have as much funding as possible. These are ways or avenues that individual countries then, such as Poland, can play a key role to ensure that brain health is a priority, not just at the country level, but at the EU level, as it will then trickle down to all the member states and keep the brain top of our agendas and at the priority level.
Dziękuję za to stwierdzenie.
Much for this statement. In Poland, we say it is very good that somebody is talking good about us rather than we praise ourselves. One of the priorities of the Polish presidency is mental health of children and adults, and I think that we can praise ourselves and present our achievements, like from zero to hero. In Poland, we have had quite bad situation in care for children with mental health disorders, and now we can show very interesting and effective solutions in this field, which are proportional to increase in financing of this field. Alexandra Lewandowska, the floor is yours.
Yes, thank you very much for an invitation. It is very true. I am smiling here because, yes, mental health for kids and adults is one of the priorities of the Polish presidency within the EU. As rightfully Dr. has mentioned this, we are in this area trying to be proud of what we managed to reach in such a short time span. In fact, in the 4 years' time, and considering only 3 unpredictable factors that happen, like pandemics, economic crisis, and the conflict, war in the neighborhood, managed to work out a new model of medical treatment for the kids and adolescents. I am in the industry for 20 years. It's been very hard for all of the stakeholders, the specialists, the patients, the teenagers, that there was no continuity of support when they needed hospitalization, or the other way around. After hospitalization, they had outpatient support required, and also psychiatric support for the children at that right age. So we needed not only a family and biological being or any other systems that the children were part of, foster families, etc., systems related to the mainstream of education, social services, and the Ministry of Justice. So now, today, in our country, we have like over 500 centers of the environmental support, psychological and psychiatric. The smallest commune is also given such a support within Poland. We have second level of referential centers for the clinics where we need a specialist care, and open day clinics for over 200 such centers. So in the last year we increased really twice the number of such centers. We all hold the third level of the referential center, which is multidisciplinary, closed psychiatric with the ward centers. We are also ensuring Also the systems that are increasing the level and shortages in the medical staff. And here I want to add that media sometimes offer shortages of the psychiatrists for adolescents, but the WHO indication is 10 psychiatrists for per 10,000 young people. And now we have this indication passed, so we are in much better situation. And in psychotherapy and therapy, we have staff in the developmental age. What we are short of, and this is something and a priority for our president, is the prophylactics, where at that level of the basic, we need a strong foundation where the three referential points should develop on. But then interdisciplinary support, we need help, definitely support of other institutions. We are looking at the model. We are identifying weaknesses and comparing to the psychiatry of the adults, that sector. We have not been implementing the system with the pilots, but we have done this systemic way. The challenge was higher. Nonetheless, the availability increased twice-fold. And we already heard the media saying of the queuing systems. Of course, we should listen to what the media deliver, but you have to remember that the number of the adolescents, they have also increased in the accessibility and availability in the public sector. Also, it is improving at the level of the admittance, and when we speak of the health services, we are ensuring the prophylactics and promotion of health will give back better results, because those disturbances and disorders, environment is the cause. And as a publicist, I think that we forget that if there was a proper education, more insurance of in the last 10 years or more in the prevention sector would not need to go into the mainstream treatment, because as you've managed, we have increased the services. We have been fighting over to increase not twice but 300% the offer, but of course not only the financial aspect is important. We should see what areas and how it should distribute those services. If we don't see the interdisciplinary support, just to end my statement, the last 2 years that we hold, we see stopping of this rapid suicidal tendencies, because in the group age of teenagers we witnessed drop down, and this is giving an indication that work in the environment with those people, adolescents and teenagers, is working out. Thank you very much for giving this interdisciplinary approach, because it does give us a way. We are saying that the Ministry is not addressing certain issues, but we don't forget it's not only the Ministry of Health. This interdisciplinary support is inevitable, essential, and we should remember that we should finance those health expenditure that is justifiable. Now, Piotr Jabłoński, who has been the head of the Drug Prevention Bureau, National Drug Prevention Bureau, he has been part of the system until very recent, and we will be talking also about obesity. Now, interdisciplinary support and collaboration. You did say we should have a coordinator of those different disciplines. Could you extend on the thought of Dr. Lewandowska? Thank you very much. Well, in fact, you've already said everything. Thank you for inviting me, and looking at the time, you have 5 minutes, no problem. First of all, we should be aware of the fact what is the role in the healthcare system and safety of our citizens are addictions, because we are not aware of the threats of addictions and problems related to the addictions in different categories of addiction as such, and public health of our citizens. There are certain studies, Professor Zatoński and others, that the crisis that we witness, the shortening of the lifespan of the Poles, is responsible, especially in the male group, is the liver manipulation or other complications out of the liver, and use of alcohol. We should be aware of that. It's not hundreds, but millions of people in Poland. The issue of addiction is part of their lives. What is the situation in Europe? Pretty well. The policy is working in the drug addiction area, illegal substances, but very scarcely the European policy on alcohol, tobacco, and behavioral addictions that are spoke of very rarely. Tobacco and smoking, new technologies of smoking, they are one of the major killers. Alcohol, as we mentioned, is having a great impact on the level of quality of life and threats to health of our citizens. Looking at the drug addictions, we have a European structures. Europe can tackle the problems better than many countries in other parts of the world. So maybe in other addictions we should do the similar. In Poland, with a great effort for many years, I underline the NGOs, local governments and central organizations, Ministry of Health, National Center. We have different approach in silence to addictions. We have one institution that is running the illegal substances taken as an addiction, but we have nothing about tobacco addiction. Problems related to counteracting results of taking tobacco, new technologies of inhaling substances. A major step would be to notice a mandate of the we run rather fruitful reform here in Poland on the treatment of addictions, psychotherapies for addictions, and the psychiatrists of the addictions could really translate and use their knowledge for, put it straightly, other addictions like tobacco and so on. There is another step which I could point out to. You've already referred to here, but previous speakers, what has happened in Poland recently. We started to not to look on the addictions as a silos concept. We are now losing ability to coordinate with other institutions. We have no national program counteracting addictions. We have no strategy. We have new modern program of health, public health protection, but the program does not consider coordination of other activities in that respect, because addictions to be tackled by medical doctors, by ministry, is an expectation unrealistic. Minister of Health needs the support of other disciplines and sectors, education, society, agriculture, Ministry of Internal Affairs, and others. We have to bring down the balance, and a position which is envisaged by the law, where we'd have an institution, ombudsman for addictions, would be an excellent solution. According to my opinion, a major step forward which could potentially change the situation. We managed, I can say, We don't like to be praised ourselves, but yes, in 2011 I want to recall Madam Minister referred to the issue of the new substances that are part of the system of the new drugs addiction, changing the thinking, and we managed to tackle the problem. The same can be done with alcohol, with tobacco, and we should really take major political decisions to support the system, which is efficient, but without the support political, without taking economic decisions, because the public health is meeting the problems of the other stakeholders, producers of alcohol, tobacco, and any others. Thank you very much, Mr. Jabłoński, Director. And let's look down at the other countries.
Every fourth citizen of the European Union is obese, and Poland, and the statistics is not the last, especially as children and young people are concerned. We have certain solutions, and Marta Pawlowska, the floor is yours. Thank you very much, ladies and gentlemen. I will start with the story, which shows the multi-sectoral character. Last year, in June, we invited to talk about obesity representatives of 14 ministries. I was called by an assistant of one of the ministers. She said, Pani Marto, you have mistaken, most probably. You invited us to the conference about obesity, but we are in charge of the culture. But you are, or education, but you organize every year events for children and treat children with some sweets which are not healthy, but you could promote sports in turn. She said, okay, you're right. So this story shows what we still lack, how to look at the problem from the different points of view, from on a multi-sectoral basis, compared to based on OECD data. By 2015, all life expectancy of all citizens of OECD countries will shorten by 4 years. For the last 20 years, on the international on the international level, a lot is being done. A lot of money have been invested. However, interdisciplinary activity is still lacking. Activity directly in groups of children and adolescents are not efficient, are not effective. I'm not going to cite them, not to spoil the whole picture. What are the countries who deal the best and have introduced effective solutions? They say only multi-sectoral approach to solving the obesity problem, just like in case of other issues and challenges in public health. We should ask ourselves, do we pose can bring something forward? We have solutions, and I hope that in several years we will say frankly that we've done everything what is needed, what it takes to tackle the problem. We have best experts, we have civil society organizations, business organizations, and state administration, and this partnership is capable to tackle the problem of obesity. Today, this partnership consists of 50 organizations, and I believe that you will hear not once about this organization, this partnership. In Poland, we have now the widest strategic principles to tackle obesity. It is based on the best practices of France, the Netherlands, Australia, USA, and Spain. Spain, 2 years ago, announced the national strategy on obesity. It was announced by Pedro Sanchez. And who is responsible for this strategy? The Vice Prime Minister, the Deputy Prime Minister of Spain, of the government of Spain. Can you imagine what is the range of priority of this program? During the international review of the program, the Spanish strategy gives an example and gives a basis for the Polish strategy. This program, the Polish program, is being commented during a number of experts' meetings, and you will probably hear many times about this document. It is being widely discussed in the scientific community. I am the member of the working group, the panel with the Minister of Health on tackling obesity. The data we collected, we have passed to experts. And we are working on the framework documents, which will be base for the upcoming strategy planned for several tens of years. Over 60 intervention instruments have been proposed in this document based on the experience of other countries and based on the evidence. We as a country have something to show, to propose, and I hope that we will be able to involve the Cabinet of Ministers, but women are persistent, and we women in partnership are capable to do a lot, and we have the mission to work, and we will do our best to promote this strategy. And I believe that this could be a Polish voice on the European platform. Thank you very much for your presentation. And now I would like to give the floor to Igor Grzesiak to wrap up in terms of the voice of the patients. How the patient's voice can be organized, consolidated, and conveyed to the politicians. We still have 18 minutes to go before the end of the session, but I will do my best to wrap up the voices that we heard. The role of the civil society organizations in the European Union is fundamental, and we see that all activities undertaken by these organizations 23 years ago, we now see after 23 years that our government is working closely with these organizations, and the patients, Ombudsman for Patients' Rights is also cooperating. as I see here, that after 23 years, the Polish presidency will be interested in the document and will organize the first meeting of the organizations who have taken part in developing this first document. This is also a part of the wider agenda, including tackling disinformation. So there will be efforts to give the status, the pan-European status to this document. This idea will become real to adopt this charter as a form of a resolution of the European Union. This activity is undertaken then today show the results, and for us as an organization and other patient civil society organizations, as a signal for us that our voice matters. What we are doing now, and now I'm looking at my colleague Marta from the Partnership on Obesity, how our proposals can evolve and spread year to year to the European scale. Now, the tasks that we are having in terms of our strategy, I believe that thanks to Marta Pawlowska and Małgorzata Gałązka-Sobota will lead to implementation. And I think that in several years, the strategy that we have created now, which is the wide strategy, will be implemented in other countries of the European Union. As our moderator pointed out, this is the world problem, and we have something to offer. This is the best time to do this. And now wrapping up my contribution. And this was already mentioned by Marta, but by Piotr. We really need to focus on prevention, and this year is the year of prevention. We need to have an ombudsman on prevention in our government, just to give the importance to this task. This concerns both obesity, behavioral problems, addictions, substance addictions. All this will be a great challenge for us in the future. Thank you very much for this voice, for this contribution. I would like to ask Madam Minister, and now first Dr. Bogi Eliasson, could you comment on what has been said?
This is very interesting, and there are a lot of things which are very comforting, but also a bit challenging. So to me, we have some hard choices to go forward with. All the ones who are on the panel have clearly stated that they want to be a part of this change. But what we really need to focus on is what are the root causes of this. So we can't just continue going for the symptoms, which we I'm not saying we on the panel are doing that, but we hear tendencies of that, and that's where the pressure comes, because you want the short and the acute. We need the long term. If we don't begin to focus on the long term, we never get to it. So if we want to have the room to do what I've heard everybody say, it actually requires hard decisions now. So David had a good point on how much we get back from investments in health. So I think it's a given that we need a new paradigm. I don't think anybody disagrees in this. Uh, and Madam Minister also said that there's a lot of value from what Poland spends on healthcare, even if many thinks it's too low. But we also need to take the discussion and saying there needs to be a cap on what is spent on health, and we need to distinguish between health and healthcare. So if we really want to have a healthy society, and here's the core question, are we working for the best health system in the world or the healthiest population? Okay? If you want the health system, it becomes a technical exercise on can you open a hospital door. If it's about the healthiest population, then you really think about the population and the patient. This is not the same thing. Both interact with each other. Sorry, I will hurry up. The patient organizations, and this is a patient audience, you have to take care of your group, yes, but you also have a bigger responsibility on joining forces, on being a part of the new paradigm. It's not just about the patient right now, even if that is a very acute need. You also really need to step in and help this transformation. This is not just an ask from me, it's an imperative if you want a better system. And here, I think it comes to very, very short things. So it's changing from a focus on lifespan, so how long can we keep people alive, to health span, how long can we keep people healthy with dignity. And that requires that we work with the knowledge that we have, so timing and precision. It also requires the question of, do we dare? Do we have the courage to do so? So it's really moving in the end from healthcare to health.
Dziękuję. Pan dyrektor Adamski.
Moja wypowiedź na szczęście będzie bardzo krótka.
Director Namski, for me, Inga, you have managed to say everything that I wanted to share with you, but thank you very much, all of the patient organizations. And another source of support and inspiration, certain initiatives are everlasting. We are speaking 20 years after the same issue, so some of the solutions are worthwhile refreshing, and therefore another issue is to not undervalue the priorities of the Polish presidency, how they are transcendental, they are everlasting, and we can do something. We really can do, not work in the theoretical field, so we can be exercising our solutions pan-European level on translation to what happens, patients' rights or challenges with which we are facing. Madame Stephanie Klein,
Your microphone, please.
My microphone is on. Do
Yeah.
you hear
Now
me?
it's on. Yes,
Okay.
now it's on. Yes.
Great. Yeah, just a few extra words there that obviously prevention here is the most important, but I think it's also just a general education to the public and to our policymakers about the issue. Addressing the key issues such as stigma, for example, can play a major role in letting people understand that that they can go. I think that addressing stigma, going early, the holistic approach to brain health as well, societal factors, all of this is really key in moving forward and prioritizing brain health.
Delvira, please, 2 minutes.
Yes, thank you. I start just answering what Dr. Bogi Ellison was asking. We want a better healthcare system to better health. We want better health. That's why we think that the prevention should be protected, also financially. And the Stability Pact can include, and it's the first time ever that the Stability Pact has some exceptions when the countries, member states, are investing in prevention. So maybe something to protect from the Polish perspective. Second is about how we empower the healthcare system to protect health. And that means skills and infrastructures. And I think Poland is paving the path, for example, on all the early diagnosis policies. We know that Poland is a leader in newborn screening. This is a kind of for decades, for 30 decades. Maybe this is the also the idea to bring from the presidency, from the Polish presidency to the rest of the countries, that we invest in these infrastructures, in this early diagnosis, in these skills, in protecting the budget for prevention. The newborn screening program is a good example, but we also learned that Poland is pushing for early diagnosis of type 1 diabetes in kids. So this is maybe one of the messages that we can bring to protect our patients, to avoid the exacerbation of chronic diseases, as a good kind of message from the Polish presidency to the rest of the member states.
Dotyczący badania przesiewowego noworodków rzeczywiście.
We are a leader here in Poland with the infants study and the diabetes type 1, what Madam Małgorzata, the screening was referred to. And Dr. Lewandowska, I'll give you the floor. With all those interventions, directly or indirectly, we're talking about better prevention than treat. Now, this is efficient that we should put the expenditure in the right direction in the disorders in health, related to health, having a healthier, happier community, spending less and having more time to ensure better quality, but also to adopt the measures in the right way and to focus and narrow down on the ambulatory treatment, also in environment, not in the mental health, but in general medical aspects. So was also heard here loudly that medicine started to develop. We have narrowing down specializations, but we cannot forget there is a patient, and we cannot just see individual arm, leg, or other part of the body, but have a holistic approach, which was already pointed out on many occasions. And this collaboration is inevitable and is necessary. And this is something I started with, and I closed down on. And thank you very much, Dr. Jabłoński. I give you the floor. Going back to the topic of taking on decisions, when we take hard decisions, it is difficult because we have the conflict of interest often. However, what we witnessed in Poland for the approach on the Silas approach, we started to have very rapid growth of addictions and treatment and the results. The results were also observed at the level of the local government, self-government organizations that were not interested in the behavioral addictions that we were discussing, that are part of the future scene in context of health issues, public health. Therefore, I think that looking down at my over 40 years of work with the addictions, when people ask me what to do, I say, for many, many years, the state agencies for solving the alcohol problems and drug addictions and other institutions within the public sector know what to do. But the issue is those activities should have a political endorsement. They should also have an interest of the health with other disciplines and disciplines in the industry, on the market, and health system would give us a better and healthier Europe if we do that. Marta Pawłowska, we give you the floor. In relation of the strategy in obesity and treatment, we have two pillars, systemic approach in the obesity treatment. One is going downwards approach and leadership, where we have a framework, national strategic document, and the second pillar is from bottom up, general mobilization, NGOs, local government, territorial units, and very large role of the patients' organizations. They are courageable. I do not know about other markets, but I can say the courage is the key word. In the partnership, in our round table, we initiated the social table with Igor Grzesiak. We spoke about the Ombudsman of Patients' Rights, Ombudsman for Child's Rights. The most important organization will be courage enough to speak about the rights of the patients in obesity. Over 9 million patients that need treatment of the obesity. Thank you very much. And Madam Minister Katarzyna Kacperczyk. We already thanked the patients' organizations, but just to have a final word to close the panel, however, opening other meetings and discussions in the future. Please don't pay attention to time aspect. People are the most important part of the conference. Thank you very much for the interesting panel, for the full context of the dialogue with the patients organizations, and civil society organizations. The exchange, the thoughts, concepts, and idea. It's a most important element, and it's a great progress in the whole system of health protection. The exchange is being intensified. We will be to a greater extent involving patient organizations and NGOs to implementation of different tasks and programs in prevention, as Minister Leszczyna referred to today in the opening speech, that in the prevention work we will also involve NGOs. We will run a competition where we can use the competences and perhaps to have the good insight from the bottom-up level, and all of the voices, suggestions, proposals at the local and European level and forum. I think there are many initiatives and plans. There are many in the different sectors within the EU, and they are very valuable. And I always state and underline, it's not the number, it's the quality. I know the European plan for counteracting cancer, but being diplomatic, it could bring more than less. And we are working during our presidency on a European plan for preventing cardiovascular diseases plan. And we are also a voice here that says, first, evaluate the European plan for combating cancer, what worked out, what did not to multiply the strategies that were already written down and mappings and so on and plans. So without the qualitative approach. But finally, we heard on many occasions in different interventions is the issue in our presidency at the European Forum, a discussion on the future of European Union for health. This is also working for the context of Poland, but I think this is the right time to address the issue. What is the role of health in the policies of different sectors? We have a debate, we have climate change findings. Whatever we do, we can adopt and use the impact on the environment and those elements that could be cross-country issue as we speak to our partners and committee. Health is the most important element of all of the efforts. It is the right time to analyze sectoral policies and their impact on health. I can just reveal a bit of secret that we, in the context of mental health of kids and adolescents, speaking on the instruments of other policies, monitoring cyber space, we have written down monitoring of safety in the network to add impact on mental health and in general health of young people, and not only. And this approach would be promoted during our presidency and in the context of European and national issues. You've been underlying this requirement, and I think that is something important for us to develop. Thank you very much. And once again, I invite you for collaboration, and all the partners are welcomed, and with the context of the presidency, not Polish government and Poland, but of all of us nationals. And we are encouraging you strongly to share what is the best practice from the NGOs and other patient organizations. Once again, thank you very much, and hope the dialogue will be outstretched and developed. Yes, we will, undoubtedly, with the Danish presidency. That's what we'll do, undoubtedly. Thank you very much.
Bardzo dziękuję.
And now Igor Grzesiak will have household announcement. In 10 minutes, we will have a ceremony on awarding grants for health. So these are initiatives of organizations which are going to receive the grants.
Ja mam przyjemność co roku być osobą, która prowadzi tę uroczystość przyznawania grantów w konkursie Grant na zdrowie firmy Gedeon Richter i Instytutu Praw Pacjenta i Edukacji Zdrowotnej w służbie pacjentów. Proszę Państwa, to jest taki konkurs, który odbywa się już po raz 5 i odpowiada rzeczywiście na takie najpilniejsze potrzeby związane ze zdrowiem kobiet w Polsce. W tym roku rzeczywiście napłynęła rekordowa liczba projektów, które zgłaszaliście Państwo, przedstawiciele fundacji, stowarzyszeń, instytucji, pacjenckich, które właśnie takie projekty skierowane do kobiet realizują. One dotyczą i profilaktyki, dotyczą poprawy leczenia pacjentek w Polsce, ale także dotyczą kwestii poprawy standardów i jakości życia kobiet w Polsce. Bardzo dużo zgłoszeń, bardzo ciekawe projekty, więc jury, które za chwilę też Państwu przedstawię, miało trudne zadanie. Te projekty z roku na rok są coraz ciekawsze, coraz bardziej rozwojowe, no ale myślę, że to już nasi goście będą o tym mówić. Szanowni Państwo, to, że tych projektów zostało nadesłanych tak wiele i że są one tak różnorodne, to też pokazuje, przed jaką skalą wyzwań stoimy, jeśli chodzi o taką optymalizację opieki nad kobietami w Polsce, tej grupy, która potrzebuje właśnie wsparcia. Nagrodę główną otrzymują dwie wyróżnione organizacje. Tą nagrodą główną jest grant w wysokości 20 000 złotych. On jest przeznaczony na realizację zwycięskiego projektu. I tak jak Państwo wiecie, bo spotykamy się tutaj co roku, podobnie jak w ubiegłym roku, tak i w tym nacisk położony był na projekty z dziedziny ginekologii, endokrynologii, ale także chorób układu krążenia czy chorób centralnego układu nerwowego. I takie też projekty zostały nadesłane. Bardzo, bardzo dziękuję i dziękujemy wszyscy organizatorzy tego konkursu za to, że wzięli Państwo tak licznie w nim udział. Dziękujemy za wszystkie nadesłane projekty. Oczywiście właściwie zwycięzców jest 2, ale wszystkie projekty niezwykle inspirujące, niezwykle ciekawe i myślę, że jest to też wielka satysfakcja dla Państwa. Oceny nadesłanych wniosków były dokonywane przez kapitułę konkursową. Tu widzą Państwo organizatorów Gedeon Richter, Instytut Praw Pacjenta i Edukacji Zdrowotnej w służbie pacjentom. Taki jest tytuł tego konkursu. Jeśli chodzi o kapitułę konkursową, to w jej skład wchodzą eksperci. Pani profesor Wioletta Skrzypulec-Plinta. Państwo doskonale znają panią profesor, ona jest niezwykle, przede wszystkim znakomitym lekarzem, ale też niezwykle empatyczną osobą. Pani profesor jest kierownikiem Katedry Zdrowia Kobiety Śląskiego Uniwersytetu Medycznego w Katowicach, jest ginekologiem, endokrynologiem, jest także seksuologiem. Pani Marta Majchrzak, za chwilę zobaczymy panią Martę Majchrzak, psycholożka, badaczka społeczna, wspólniczka w pracowni badawczej Her Stories i dyrektorka merytoryczna Sisters of Europe Polska. Kolejną osobą w kapitule, która decydowała o przyznaniu grantu, był pan Igor Grzesiak, wiceprezes Instytutu Praw Pacjenta i Edukacji Zdrowotnej, a kolejna osoba to pani Aneta Grzegorzewska, dyrektor do spraw korporacyjnych i relacji zewnętrznych Gedeon Richter Polska. Proszę Państwa, na sali są z nami przedstawiciele organizatorów. Jest z nami pani Agnieszka Boryś, kierownik działu PR Gedeon Richter i pan Igor Grzesiak, wiceprezes Instytutu Praw Pacjenta i Edukacji Zdrowotnej. Zapraszam Państwa na scenę. Oddaję głos najpierw pani Agnieszce. Myślę, że będzie dla nas bardzo ciekawe, jak z pani perspektywy wyglądał ten tegoroczny konkurs, jakie to były projekty, co Was zaskoczyło.
Dziękuję bardzo. Dzień dobry Państwu. Szanowni Państwo, ja może powiem na wstępie tak, że troska o zdrowie kobiet to jest dla nas temat fundamentalny, który się przejawia w naszej codziennej pracy, gdzie skupiamy się na dostarczaniu terapii, jak najlepszych terapii dla kobiet, ale zdajemy sobie sprawę z tego, że no nie tylko terapie to jest zadbanie czy wyraz tej troski o zdrowie kobiet. To jest właśnie wsparcie kobiet w zdrowiu psychicznym, w ich codziennych zmaganiach się z różnymi sytuacjami, ale to jest też także skupienie się na zaadresowaniu ich takich bieżących potrzeb zdrowotnych. I właśnie ten konkurs Grant na zdrowie jest to jeden z takich projektów, w którym my odpowiadamy na te potrzeby związane z jakością życia kobiet i naszych pacjentek, gdzie skupiamy się na takich projektach, które właśnie odpowiadają na bieżące potrzeby. Z tego, co Pani mówiła o liczbie wniosków, które spłynęły do nas, no to pokazuje, jaki jest potencjał ogromny i jakie są tak naprawdę ogromne potrzeby wśród pacjentek, więc na pewno zaskoczeniem dla nas największym i największą radością dla nas jest to, że tych wniosków czy projektów spływa z roku na rok coraz więcej.
To bardzo ważne to, co Pani powiedziała, mianowicie wydaje się, że te projekty, które Państwo nadsyłacie, przypomnę, to już 5. edycja tego konkursu, one też jakby wydobywają często z takich otchłani niewiedzy pewne problemy, które dotykają kobiet. Często kobiety o tym nie mówią, nie sygnalizują tego, a dzięki Państwa działalności, dzięki projektom, które proponujecie w tym konkursie, nagle okazuje się, że to są problemy ważne i trzeba o nich mówić. A co zaskoczyło Pana Prezesa Igora Grzesiaka?
Mnie zaskoczyła, Szanowni Państwo, ja się nie będę po raz kolejny witał. Mnie zaskoczyła tylko jedna rzecz, ale nie będę jej zdradzał teraz na początku, zdradzę ją za chwilę. A tak naprawdę ja muszę przyznać, że jestem z Was, koleżanek, kolegów moich bardzo dumny, że po raz kolejny rok udowodniliście poprzez swoją kreatywność coraz lepszy poziom pisania tych wniosków, że macie niewyczerpywalne, chyba mi się wydaje, takie pokłady energii, zaangażowania i kreatywności, naprawdę, o której mi się wydaje, że w takiej naszej codziennej pracy społecznej jest bardzo trudno, bo też ten konkurs, on w sobie jest jakby bardzo atrakcyjny dla nas wszystkich, ale na 40-50 aplikacji my możemy przyznać tylko 2 nagrody. Mimo tego, że możemy przyznać tylko 2 nagrody, co roku te 40-50 aplikacji, wniosków do nas spływa. I to naprawdę, i za to ja składam serdeczne podziękowania. Naprawdę to też się przyczynia do tego, że te projekty, które składacie, one są coraz lepsze. Te pomysły można wykorzystywać również w innych programach aplikacyjnych, bo naprawdę są świetne. I ten poziom, który był w tym roku, on z roku na rok ja widzę, że się naprawdę wyrównuje. My oceniamy niezależnie, każdy z nas, każdy członek kapituły w swoim biurze, w swoim otoczeniu, my się nie spotykamy, przydzielamy punkty, te punkty są sumowane i na podstawie tej średniej są wybierane 2 najlepsze projekty. Ale tak jak powiedziałem, no, można powiedzieć w tym roku ten peleton był bardzo długi, ale 2 najlepszych jest. I zaraz o tym zaskoczeniu.
Zaraz powiemy, kto jest tym najlepszym, ale rzeczywiście wybór kapituły musiał być bardzo, bardzo trudny, bo tak jak wspomnieli Państwo, te projekty po pierwsze liczne, a po drugie niezwykle ciekawe, coraz lepiej wymyślone. I proszę Państwa, teraz pora na to, aby ogłosić wyniki i poproszę Panią Agnieszkę Boryś o to, aby przedstawiła nam pierwszego laureata.
Ja się posłużę ściągą, żeby niczego nie przekręcić przypadkiem, więc pierwszą nagrodę w wysokości 20 000 złotych otrzymuje Polskie Towarzystwo Zdrowia Publicznego za projekt Macierzyństwo jest możliwe, czyli zwiększenie świadomości na temat dostępności i możliwości leczenia ciężkiej niewydolności szyjki macicy metodą szwu przedbrzusznego wśród kobiet oraz lekarzy, ginekologów, położników.
Brawa, gratulujemy. Polskie Towarzystwo Zdrowia Publicznego. Zapraszamy przedstawiciela na scenę. Zapraszamy bardzo, bardzo serdecznie. Prosimy o odebranie tego symbolicznego czeku. Brawa dla Pani. Witamy. Zapraszamy na scenę. Polskie Towarzystwo Zdrowia Publicznego za projekt Macierzyństwo jest możliwe, czyli zwiększanie świadomości na temat dostępności i możliwości leczenia ciężkiej niewydolności szyjki macicy metodą szwu przedbrzusznego. Brawa dla Pani i gratulujemy bardzo, bardzo serdecznie. Prosimy o kilka słów.
Dla nas bardzo duże wyróżnienie, jeszcze słuchając, że tyle było wniosków i że zwyciężyliśmy. Jest to naprawdę bardzo duże wyróżnienie. Chciałam powiedzieć, że ten projekt jest dedykowany właśnie dla kobiet. Tradycyjne metody leczenia niewydolności szyjki macicy nie sprawdzają się, a sprawdza się metoda szwu przedbrzusznego. Jest to projekt dla kobiet, które macierzyństwo. Chciałam też powiedzieć, że kiedyś ja straciłam taką nadzieję, ale właśnie dzięki tej metodzie mam dwójkę wspaniałych dzieci urodzonych o czasie.
Dziękujemy za podjęcie tego tematu i za pomoc tej grupie kobiet. Tak jak Pani powiedziała, ta wiedza właściwie nie istniała, prawda? Nie było skąd jej czerpać. Serdeczne gratulacje, brawa dla Pani. To jest ten pierwszy grant przyznany w konkursie Grant na Zdrowie. Pan prezes Igor Grzesiek.
Proszę z nami zostać, tak?
Robi zdjęcie.
To jest moje zaskoczenie. Zaskoczony poprosiłem. Na realizację projektu pod tytułem Edukacja dla szkół, którego celem jest szerzenie edukacji o endometriozie wśród uczniów, nauczycieli i rodziców. Dlaczego zaskoczenie? To sami możecie odpowiedzieć na to pytanie, ponieważ Lucyna 2 lata temu chyba odbierała nagrody po raz pierwszy.
Drugi raz
Naprawdę,
już.
i to tylko pokazuje, że tutaj to jest najważniejsze, jest jakość pomysłu. Dziękuję.
No to prawda, Fundacja Pokonać Endometriozę drugi raz zostaje nagrodzona grantem na zdrowie. Brawa i gratulacje. I prosimy o kilka słów.
Proszę Państwa, bardzo serdecznie dziękuję za zauważenie tego naszego wysiłku, bo on cały czas trwa i powiedzmy, mogę powiedzieć, że jesteśmy w procesie cały czas tego, że w tym roku mam nadzieję, że do systemu endometrioza wejdzie. Ten proces jest momentami bardzo taki wyczerpujący, ale robimy wszystko i mimo, że musieliśmy się na chwilę zatrzymać i poprawić pewne rzeczy, idziemy do przodu i efekty będą. Natomiast my wzorujemy się na Australii. Australia i Ministerstwo Australijskie Zdrowia wprowadziło do edukacji właśnie w szkołach program o endometriozie i czym jest i jak powinno się zwracać uwagę na symptomy tej choroby i gdzie powinno się udać. I my chcemy, żeby u nas też w Polsce, ponieważ dla nas profilaktyka to jest właśnie edukacja, bo my kobiety chore na endometriozę nie mamy takiego jednoznacznego badania, które nam wskaże z krwi na przykład jesteś chora na endometriozę, tylko musimy się edukować i na podstawie swojej wiedzy później trafić do eksperta. I to jest bardzo ważne, aby te małe dziewczynki, tak jak ja, byłam małą dziewczynką i nie miałam tej wiedzy. Gdybym ją miała, trafiłabym o wiele szybciej i nie straciłabym prawej nerki. Więc nie chcę, żeby diagnoza trwała 16 lat, tylko żeby wyedukowane dziewczynki, dziewczyny, kobiety trafiały szybko do ekspertów i miały gdzie się leczyć.
Bardzo Paniom dziękujemy za to, co robicie. Przede wszystkim za edukację, za profilaktykę, to co Pani podkreśliła, Pani Lucyno. Gratulujemy Paniom bardzo serdecznie. Gratulujemy zwycięstwa w 5. edycji Grantu na Zdrowie. Brawa dla zwyciężczyń, ale też brawa mogą być teraz.
Brawa dla Państwa też przede wszystkim.
I dla wszystkich Państwa, którzy nadesłali swoje projekty, wzięli udział w tym konkursie. A teraz prosimy operatorów, fotografów do zrobienia pamiątkowych.
Zapraszamy Panie.
Tak, dziękuję, mogę. Jeszcze raz serdeczne gratulacje Państwu, także dziękujemy za udział w tej uroczystości. Miłego wieczoru i zapraszamy jeszcze do kuluarowych rozmów. Bardzo dziękuję.
Dziękuję. Ja ze swojej strony raz jeszcze gratuluję. Możemy zakończyć transmisję online. Same kończymy pierwszy wieczór online. 19 Państwo, dzisiaj spotykamy się jeszcze dla tych